7:02. I'd like to call the meeting to order. I'll just cover the public participation. Any public participation out there? Seeing none. Two sets of meeting minutes to look at, if we could approve those, and then we'll move to the discussions. So the first meeting minutes was March 23rd for Health Insurance Subcommittee, and prepared by Dawn, I believe, and on the committee, Dawn, Zach, Gary, and Dan.
Yep, I'll move approval of the minutes.
Okay, Dan, second. Thank you, both of you. Any discussion on the minutes? All right, thank you, whoever wrote them up. Good overview, appreciate it. Read it over. It ties in with some of the stuff Steve had on his email. So very good. I'll entertain a motion to accept. All those in favor?
Aye.
Aye.
Unanimous. Thank you. Next set of meeting minutes is March 31 for the Finance Committee meeting minutes. Anyone?
Move to accept.
Second.
Bill, second by whom? I'm sorry.
Dan.
Thank you, Dan. Any discussion on these minutes? I didn't see anything glaring. All right, all those in favor of accepting the meeting minutes for the Finance Committee, March 31, 2022?
Aye.
Anyone opposed? Unanimous. Thank you. All right, so we have, I believe, Steve, you want to tee this up, a presentation, right?
Yes, Anthony Choi is our health director, and there was some questions before about, or people requested some metrics, I should say, and he's done a very good job of putting together a very good reasoning and support for what we're trying to do with the Board of Health. I will say that, you know, I think part of our great services that we've added over the years started many years ago with the police department and starting the CIT program. And I will tell you that I took some wax on my back then when the rumor going around town was that I used town funds and bought them all lobster rolls at the end of their training. That did not happen, but we maybe bought them a sub for lunch. So I think it's been a great program going forward, and this is an extension of this in the current world that we're in. And Anthony, you're up and you should be able to share your screen.
Thank you, Steve. All right, can everyone hear me?
Yep.
Yes.
Just testing. Can anyone hear me?
Yep. Yes.
Yes, can you hear us? Yes. You can't hear us, Anthony?
Can everyone hear me?
Yes.
Yes, can you hear us?
Yes, I can hear you guys.
Thanks.
All right. So, thank you again for the introduction. Thank you everyone for being here tonight. I think it would be great if we could give you guys all some insight into the Health and Human Services Department, everything that goes on a day-to-day basis, and kind of the background that we're working in right now. And so hopefully this will give everybody a better picture, give a better sense of, you know, the reason why some of these positions are being proposed and how we envision moving forward with this. So share my screen. All right, can everyone see the presentation?
Yes.
Yes.
So to start off, I think we want to address first the inspections piece. Inspections are one of our minimum statutory requirements for our local Board of Health. Something that we address in a large part are the food inspections here locally. And so I want to quickly go over some of the numbers associated with food inspections. So to start off, I want to give everybody a little background. The FDA Food Code gives us basically an outline of how we should address risk-based inspections. And so this is based on the idea of risk associated with certain types of establishments, types of food they serve, and the scope to which they serve the community. And so to give everybody a breakdown, the level, the number of levels here, 1, 2, 3, and 4, correspond with the minimum number of inspections the FDA requires of us to perform each year, depending on the store type. So we're going by, in terms of risk, level 1, that is the lowest risk. Those are by, for example, convenience stores. We have 42 of those establishments here in Wakefield. That's 2021. Our catering businesses are level 2. Those have somewhat higher risk. They may have heated foods that require temperature control. So those are level 2 businesses, and the catering businesses are an example. We have 60 of those establishments. So those establishments require 2 inspections per year minimum. Level 3 are your typical restaurants. Those restaurants include direct food contact and TCS foods. And so we want to make sure that those restaurants are inspected and up to code for the safety of our Wakefield residents. Those we have 20 of in Wakefield, and so those require a total of 60 inspections routinely. And level 4, the highest risk groups, we'll use nursing homes and rehabs as an example. Those are places that serve individuals at highest risk. And so we have 5 of those establishments in Wakefield. That equates to at least 20 inspections per year that we should be getting to. On the left, you'll see food service establishments make up the large majority of our food permits. And then we have retail food stores, caterers, and temporary food establishments, and mobile food units. And so what's really important to highlight is that we've really been transitioning from the previous model where every type of establishment gets the same amount of inspections. And just from a safety standpoint, it makes sense that those that are at higher risk, those that serve foods besides prepackaged foods, should require more inspections. I think one of the things that we want to drive home is that the total 242 inspections are just routine food inspections. Those are the minimum that we're required to do. That does not count all of the re-inspections we have to do when we do find critical issues, any kind of violation based on the food code. We want to address those as soon as possible. And some of these types of violations actually have a certain time window under which they have to be addressed. And so along with the routine food inspections, we had 25 re-inspections required. And so these are generally critical violations or accumulation of non-critical violations, generally situations where we had to go back and re-inspect to clear the business to reopen. And so on top of the 242, we have re-inspections. We also have pre-operational inspections. These could be new businesses opening up. These could be businesses reopening for the first time. We could have temporary food events coming in. So these are all the things that go into each year. And what I will say is a lot of the events that were going to take place, some of them were canceled last year. And so we only really expect to see pre-operational inspections increase this year as well. So the time associated with routine food inspections, those are associated with the risk level. And so it would be reasonable to expect a level 4 establishment, the inspection time to require more time than a level 1 establishment. And so as you can see, even though there are less level 4 and level 3 establishments, those sometimes take more time to inspect and to make sure that they are in compliance. And so along with re-inspections and pre-operational inspections, we also have foodborne illnesses. These are mandated events that we have to inspect along with public health nursing. We want to make sure that we're following up with the state investigation on potential breakouts of Salmonella, E. coli. We had 7 of those in 2021. And so these are things that are mandatory. These are things that we have to address along with the food establishment complaints. These food establishment complaints could be coming from consumers visiting our establishments. These could be coming from folks working in these establishments. These are a variety of complaints that involve possibly gloves not being used by food prep, employees eating rodents, anything else that you can think of associated with food establishment complaints. Those are things that have to be investigated whenever there's a complaint being made. And so all told, we had 300 total Wakefield food inspections required for the last year in 2021. And this is, a summary number of all the metrics that we just put together. According to the FDA minimum statutory requirements, and this was outlined in Strategy 8 of the FDA code, it can be reasonably expected from a full-time inspector to address 280 to 320 inspections a year. And so one FTE would be able to fulfill that. And so currently we have 300, and that falls within that range. So if we had one dedicated inspector that only did food inspections and nothing else, we could meet this minimum requirement. Something we want to keep in mind along with this is that food establishments only make up 9% of our complaints.
Hey,
And so
Anthony, sorry, it's Doug Butler. Can you go back to the last slide? I'm trying to understand, you didn't talk about it, but what does that red box, actual 85 food inspections completed in 2021 mean?
Yes, so let me move this box real quick. So the 85 food inspections completed in 2021, that's our actual inspections completed in 2021.
Okay, so if I'm to understand this correctly,
Yes,
the other numbers on here are sort of your theoretical FDA statutory requirement that we've fallen short of by roughly 70% for our whole time here.
the only theoretical number on here is actually the routine food inspections. The 25 re-inspections, the pre-operational foodborne and food establishment complaints, those are all actual numbers.
So the 242 though is mythical.
So I explained, yes, I explained the 242
Yeah,
number,
I get it,
but
you only did 85, so you didn't. So which did you skip here? Like, in terms of, even you didn't visit, or somebody didn't visit any number of these establishments even once?
that's correct. There are establishments that have not had a visit within the last 2 years.
Okay, I guess the question is then why is that a problem?
So let me try and address this. So establishments that require an inspection, these are all food establishments. If we don't do any kind of prevention work, it sounds like what you're saying is that establishments don't need, inspections at all.
Well,
Except for
I'm saying that
complaints.
I don't know, you came to us with this 300 number.
Yes, that's correct.
But we've actually probably never done, 85 is probably the most we've ever done. So help us understand why we're going to all of the sudden jump this up fourfold when we don't seem to have much of a problem here.
So the issue here being, if we don't see an issue, then we're in the clear. It seems a little misguided for me to say, if we haven't seen a disaster yet, then we won't have it, right? I don't see what you're getting at in terms of, foodborne illness complaints that can be prevented. If we don't address these issues beforehand, is it not more likely that there's going to be issues moving forward?
I don't know. I don't know that we've, my guess is we haven't really seen much of this. And I guess the pushback on all this is, Anthony, you're making as I said before, this is a bold land grab by the health department here. And this seems to me to be, an insane overreach, Steve. And frankly, I'm I don't know how you let this happen, but I can't, especially when we're being presented, Anthony, you were all set to skip over the fact that we only did 85 last year. You weren't going to bring that up at all. That's this is just not, I feel like this is disingenuous. So I guess I don't need it to any further.
Mr. Butler, I would respectfully disagree with what you're saying. I didn't skip over the 85 because I wanted to show that besides the food establishments, we have all these other things that we are charged with. I would say who has the responsibility when something happens at a restaurant, when a consumer falls ill? Who has the responsibility and the liability besides the local health department? I'm trying to figure out from your standpoint, when something happens and the state comes down and says, how could this happen? When was the last inspection done? Who is going to take that liability? It would not be the finance committee. It would not be yourself, Mr. Butler.
Right, so I think what we need to do is there's a couple of other questions, but I guess I assume you didn't gloss over the 85 maliciously, but
No, actually, to be totally honest, it's very difficult to go over something that you are not completing. I think the biggest point for all departments is we want to show that we're doing a good job, that we're fulfilling all of our duties. But to be totally honest, we could never ask for more resources if we can't show that there are things that we need more of. And I think the 85.
The FDA requirements are supposed to be followed by cities and towns, is that right?
Yes, that is correct.
Bill, do you have a question?
Well, I think, I brought this up from the perspective of saying, Anthony, during your original presentation, that there were no metrics to support the head count, and that's, appreciate you coming back to us. So on that theme, what you're presenting here, what you're proposing the head count would accomplish, is this what you would consider best practices? Or again, I'm a little bit lost as to whether or not it's FDA required or, so can you just kind of talk about that a little bit? And then, and can you also elaborate, what do other towns do? As Doug points out, if you're doing, 25 or 30% of, what you want to do, is that common practice? I'd just be interested in knowing that.
Sure. Yeah. So I can speak to the last question first. So in terms of other towns, I think one of the things that we're doing in Melrose as well, that's the other community I serve. We are proposing the same thing. We are seeing a very similar number of food inspections. We actually have slightly less in Melrose, but it falls within the same range. And so we are proposing the same one additional food inspector. So we will have a total of 1.5 FTEs in Melrose to cover the 280 to 320 range for food inspections. I think to compare us to other towns, we have certain FDA codes. So I'm going by the most recent 2017 FDA code. It is something that we want to strive for. Previously, there are inspection schedules that are less stringent. And so, it may only have required 2 inspections per year for each type of establishment. But the reason why the FDA moved towards this risk-based scheduling is because we found that establishments that serve higher risk foods require more inspections to stay in compliance and to have the most protective effect for communities.
Were we in our current state of inspections at any risk specifically with any compliance issues with, again, we keep talking about food and drug. I mean, are there parameters or we've run afoul of or that we could be cited for? Or is it just, I don't mean just, but that if something happens, you could come back around and say, well, we simply don't have enough head count to cover all that we should be covering.
So I'm trying to understand. So the question is whether or not we have actual risk or if we're just fulfilling the requirements.
Yeah, by Food and Drug Administration standards, are we non-compliant, I guess is a way to express it. Are we not compliant with what Food and Drug Administration says in terms of its inspections?
That's correct. Yes, I think I'm understanding you correctly. Are we not meeting the minimum that the FDA is asking us to do? And yes, that's correct.
Okay. But I guess we never have, right?
No, we have not, and we never had the resources to do so.
No, but we've never been compliant is what I'm saying. So it's never been brought to the point of saying we need additional headcount in order to be compliant. At least not, I don't ever recall having a conversation like this in my time on the, finance committee. So, okay.
Ed?
Just a quick question, and Anthony, I do appreciate the presentation and it's very detailed and instructive. Let's get back to the 85 food inspections in 2021. Is that a typical year or do we do fewer because of the pandemic or what did you do in prior years?
So in prior years, we also had, about the same amount of inspections. This was just 2021. I think the number is not as egregious because we had some food establishments closed during 2021, right? And so some of the reopening was delayed. And so in total, we may have had slightly less establishments, but the 85 food inspections were only able to complete because we had the original position filled, the health inspector plus a senior health inspector.
Right.
Yes.
You're looking to hire staff, additional staff to do this. Have you looked at contracting that out as opposed to hiring? I know from my own experience, it's been very difficult to hire inspectors given the job market.
Yes. So in terms of hiring inspectors, I'll give you kind of a insight into that. There is no regulated way. There's no established pathway as some other careers may have for inspectors to become credentialed. More recently, we've seen a slight increase in qualified candidates. The shared position, health inspector, that's not the senior health inspector, that's the original health inspector position. We just went through a round of hiring and we were lucky enough to fill that position with a qualified candidate. And so they're going to be starting soon. That gives us 1 FTE in Wakefield. But that's the trend now, is that the state is putting more resources into training inspectors. In terms of contracting out, it gets very costly very quickly because these contracts end up being, the initial inspection, they give you the report, but there's no follow-up. You have to pay for the follow-ups as well to make sure the compliance is met. It doesn't really serve us much good if we're able to only identify the errors but not follow up.
Okay, so you've looked at both options and you see that
Yes.
contracting out is more expensive to do that.
Right.
Okay.
Yeah, Ed, we did use contractors. We've used them a lot. It's just doesn't seem to work as well. as
Okay.
Anthony said.
All right. Thank you, Anthony.
Brian? Excuse me. Muted.
Oh, I think
Brian?
he's muted.
Oh, for heaven's sakes, I've never been on a Zoom meeting before. I want to thank you for, again, your presentation. And I wanted to ask the question, had you actually gotten to the end of the presentation?
No, this is actually just the beginning. I'm sure that's what everyone wants to hear.
So I guess my point is that there's every chance that the number 85 would have been gotten to at some point later in the presentation. Is that correct?
Well, so I separated this section out as the food inspection section first, and then I would have, addressed the 85 before I moved on to the public health nursing section as well as the social services.
No further questions, Your Honor.
All right, let's continue. Doug, your hand is up. Sorry.
Or just my last thing around this, and it gets to the question of the food code and the FDA really is, and I think Bill asked it fairly directly, but I don't know that we got an answer there. From what I'm seeing, it is a best practice and a model and a recommendation, not a requirement. Not, we're not out of compliance because it's model and recommendation. It is not because obviously, by the way, we would have never done something where we were like 1/4 of the required mandate, I don't believe, as a town. So I guess that's my follow-up would be, is the FDA food code from 2017 really a model, or is it a requirement?
I would say it would be a shame to not do the best practices when the possibility is there.
So it's the model.
Doug's smiling, Anthony, because you're not answering the question that he asked. Is it a
So
requirement? or
it's
is it
not
best-
it's not a federally
practice,
mandated requirement, correct?
No, it is not. It is a model and it's best practices.
Very good.
Okay, that's the answer. Thank you.
Dennis?
Is this person you are proposing a shared person between two communities? It actually, we're only saying a half an inspector for Wakefield? Or are you proposing one in each community? And will they both be shared between communities?
So to clarify, we are asking for 1 health inspector to be dedicated to just Wakefield And then the existing senior health inspector would not change. They would continue to spend half their time here.
But do you have one full-time inspector beyond the senior in Melrose?
Currently, no. We are still sharing one inspector and one senior health inspector. Is that the question?
So Melrose doesn't have any and Wakefield has one.
So in Melrose, I am proposing the same thing. I'm proposing for one full-time, only Melrose inspector and continue to share the senior health inspector.
So one in each town and the senior is shared. Is
Right.
that correct?
Yes, that's correct. Thank you, Jim.
And for Wakefield, that's an increase of 1/2, because last year we shared one inspector between both communities. So this is a 1/2 person increase for Wakefield,
For the inspector.
for the inspector, yeah.
That good, Dennis, for now?
Yep. Thank you.
All right, Anthony, please.
So to recap, so we just talked about food and food inspections. I think the other piece that's important to understand is that housing is another big piece of our puzzle here. And so whenever we have a housing complaint, we have to respond. We have to make sure that conditions are habitable. And we have to make sure the safety of the resident is guaranteed. So housing actually made up 21% of our total complaints in 2021. And outside of housing, we also have to work with complaints from trash, dumpster, yard, noise complaints, odor complaints, rodents, and environmental complaints. And so all of these categories make up our total complaints. And so the way we're seeing it is that if one FTE can fulfill the minimum number of food inspections that we're looking for, we can hopefully have the senior health inspector deal with more complex cases and deal with more housing cases. And so we can then, address all of these equally. I would say from this point of view, we're looking at COVID and businesses. This took up a lot of our last 2021. I can't say for sure that COVID's not going to be an issue in the fall, but we can't, we can't reasonably say that it's going to be the same impact as it is this year. So this will change. This will change in terms of which categories take up more of our complaints this year. But I think the important takeaway here is housing complaints. Those are generally very complex, usually involves multiple departments. And later on in the presentation, I will highlight what percentage of these housing complaints actually has an additional social service need that's identified. I think that's an important thing to understand, is that these generally don't happen in a vacuum. There's generally other things going on as well. And so to adequately address housing, we want to make sure that we're freeing up our best expertise, and that's our senior health inspector that will be training our health inspectors to really be able to address these concerns to the fullest extent. And so I just want to go over the majority of the permits that we deal with within the health department. And so we work with all of these to some extent. We have our own animal control department, so we do not address those complaints, but we do work with the permits. And so outside of just food and housing, there's a whole lot that goes into this. We do pools, we do camp inspections, tobacco, we do funeral homes, tanning. We also work with body art and body work. These generally are smaller in number. We don't have as many of them here in Wakefield, but these are more complex. We do have to do the inspection and make sure that they meet sanitary code. We have temporary food, we have lodging, and we have septic and wells. And the farmers market is a big one every year. And so all told, our permits total 43,000 in the last year. And so I think it's important to understand the wide scope of a health inspector, right? So it's not your traditional just doing your food inspections. It's housing. It's a lot of these issues that come along with town. And so we have a lot of these resources, and we want to make sure that we are inspecting and making sure everybody can stay safe. So I want to shift gears a little bit. So that was the health inspector side. I want to shift gears into the prevention and social services realm. And so the best way I can kind of explain this is if we talk about the Wakefield Community Health Profile. And so on the screen here, you can see that the health and disease indicator, these are the things that from the last community health needs assessment, this was done in partnership with the Melrose Wakefield Hospital, or Wellforce now, or whatever they're called now. We do work closely with them to identify the needs in Wakefield. And so one of the, a lot of these measures that we're looking at is how we can gauge what the needs are in the community. And so in terms of all cancers, the percentage that Wakefield is above the state average was 11%. We have other cancers we can see here that are, substantially higher than the state average. We're looking at opioid overdose ED visits. We are at 80% over. And I think one of the bigger ones that I want to highlight are the population eligible for SNAP who are not accessing the financial benefits. And so this SNAP gap is a great highlight in terms of, we will never have enough staff or funding to become the primary service provider. That should never be the goal, because we are not, in Malden, where Malden has proposed 7 recovery coaches and 4 social workers. We're never going to be at that point, but what we can be is the best connector we can be for the community. And so, one of the things that everybody has mentioned here and there is, why aren't we utilizing resources that are already out there? And so I want to highlight that SNAP is a resource for individuals. But we can see right here, 23% of the population that's eligible, we are at a higher 23% of the population eligible for SNAP that are not accessing these benefits. And there's a variety of reasons. There's folks that just don't know that it's out there. We have to be able to get them education and get them to know about the resources that are available to them. There are folks with language barriers. There are folks that just don't know how to go about, applying for SNAP. And they may run into trouble here and there, and they don't know where to go to get help for this. And so it is our job as a health and human services to help the most vulnerable in our community. And by leveraging the resources that we already have, which is, for example, one of them is SNAP, we hope to close that gap and utilize everything that's out there so that there's more individuals accessing the resources that are already there. The other thing that we want to talk about is prevention. And I think prevention takes on several forms, one of which is through public health nursing. And so just in the last year, we had 7 COVID clinics. We had 2,200 vaccinations. This was regional. This was a regional effort. We had 3 flu clinics that was just between Melrose and Wakefield, and those resulted in 800 vaccinations. We also help with shingle vaccine. Another big part of it is, data upkeep and data analysis. We have to work with MIIS, which is the Vaccine Information System, and we have to manage vaccine records and update them as we go and make sure, because right now we don't have the resource to go through the database, but it is a local responsibility to make sure that those records are accurate. And currently, when we go through the system, we find duplicates right now, we find records that are incomplete. And so we need to make sure that those records for our individuals in our town are correct and up to date so they can receive the most accurate care. Just to give kind of an overview, we've had 4,000 COVID cases in the last year. And so this is an important number to keep in mind because this is a lot of what we were doing, but other diseases didn't stop. And so we saw cases of TB, Campylobacter, we had Hep C, flu continues, it's a yearly issue. We had rubella, varicella. We had all of these issues that we identified. And so a lot of these issues are, can be attributed to, prevention, lack of prevention. We're not doing enough to reach individuals and address these issues and let the community know of the risks. And so what we're seeing is then we have to deal with these cases afterwards. We have to perform contact tracing. We have to figure out if the individual is accessing care, where they are in that spectrum, and then make sure that they are receiving the care that they need. And so this is an important piece of what we're doing. This is the more reactionary piece. To prevent having to do this as much, we have to work on the prevention side as well. That comes with educational clinics. That comes with camp inspections. That comes with blood pressure clinics. Those are all things that we can do to help improve the general health of our population, especially those that are in the most vulnerable. Our senior citizens need those resources and need, our town to step up and make sure that they have the education and the resources they need so they can access the best care. The additional FTE, the 0.5 FTE that we are requesting for the public health nursing, so that would be a part-time public health nurse that would work with our current full-time public health nurse. It's split between Melrose and Wakefield. Part of it is the health promotion piece, what I was talking about. So we have classes that we can offer, CPR, choke saver. We have disease prevention. And so tick-borne illnesses are only going to go up as people go outdoors more. We have reports of avian flu recently. These are all things that are addressed by a public health nurse. Seasonally, we have summer camp inspections. Those are important as well. We have walk-in triage. We give out flu shots. We also do homebound flu shots. We are working on a program to give homebound COVID shots, homebound wellness visits. These are all things that feed into health maintenance and prevention of disease. And so I think all of this is a bigger picture way of looking at how public health nursing works in the system and helps us prevent the disease. So I want to turn now to the social service needs and the prevention piece. And so it's very difficult, I'm going to admit it's very difficult to quantify directly the impact of prevention and social services on the outcomes of our community. But there are metrics that we can point to and show that there is a need. I think it would surprise a lot of people to know that 1 out of every 22 residents in Wakefield falls below the poverty line. In FY20, the food pantry served 821 households. There was some disruption with COVID moving forward, but the Wakefield food pantry continued to serve many households. From FY20 to 21, mental health calls that Wakefield police responded to increased by a staggering 87%. It's really important to understand that, every time you turn on the news and you hear about mental health being an issue, hear about substance use being an issue, it's not just a national issue. It's a national issue, but it also takes place here. It takes place closer to home at Wakefield. We're not immune to that as well. Wakefield actually had nearly twice the state suicide average, 16 versus the 900,000. And so these are just, scary numbers to see. This is across the board. We have issues with general population. Our school populations, they're also vulnerable. We also have seniors. I mean, these are groups that are disproportionately affected. So we want to make sure that we are addressing these issues with all groups. And one of the metrics that really quantifies the cross-disciplinary work that we do, 60% of our housing complaints actually had a social service need identified. And I think it's important to understand that we could blindly go issue orders to correct. We could, just have folks, just find them and then, not follow up with them and just, take them to court. I think this is the wrong approach to all of this. I think that there is a social service need in 60% of these housing complaints, and we have to address these as we see them, or else it would be negligent of us not to do it. And I think that only feeds into, when you're not addressing these issues, these are only going to get worse. And so what we're seeing is folks are suffering from, the side effects of the pandemic, being isolated for so long. There's behavioral health issues and just things that people need help coping with. And I think part of it is just we have to be able to connect them to the resources that are already out there. I can take a pause. Looks like Bill had a question.
So the middle block about the mental health related calls to the police increased by 87%. So that's a large number. How many of these are the same people going back and back and back and back and back and back, as opposed to net new potential clients? Yeah.
So you're referring to basically the idea of high utilizers, folks that have repeated use. And I'm gonna go into the next slide. I'm gonna kind of break it down a little further. We don't have necessarily, when we can break that information out in terms of unique individuals. unique individuals utilizing this resource. But I think part of it is there are more people involved in each case. So it's not necessarily just one person, right? There's other folks involved.
My already listening here, Anthony, would be the same people, some of the same people going back and back and back. And I guess I'm just curious, is that, each incident recorded as an incident such that it doesn't contemplate that I went in there 5 times last year, which I didn't, and I went in 25 times this year. So that's what I'm just curious if you have that kind of data that way.
We don't, if you're telling us we don't have that number on hand, I can provide that.
I would suggest that's something, if you don't have it, you should, because I think that's a truer picture than the way it's depicted here. I suspect a lot of the people are repeat customers, if you will, for lack of a better way to say it. Anyway, that's all. I was just wondering if you had that handy. Yeah, thank you.
So I'm going to go into a little bit more detail. So I think Bill's right. I think if we're able to break out those are high utilizers, I think that would be a good representation of those accessing services. I think, however, whether or not they are high utilizers or if they're unique situations, I think it's still important to understand that each time there is an incident, there is a response, right? And police and fire use their precious resources, and they have to go out to these events. And so I'm going to highlight right here the difference from 237 to 444 mental health related responses. And I think the other metric that's pretty eye-opening is total domestic violence related calls. And so again, we haven't broken those out into high utilizers, but we're looking at a large increase in terms of these calls. And this is not Wakefield specific. This is not unique to just Wakefield. I think it's something that we have to understand is happening everywhere, but we have to address it hopefully.
Do you have more slides, Anthony? Do you want to cover the rest of this slide first, and then I'll take Doug, or where are you at?
Sure, I can take a question.
Doug?
Or Anthony, like that, these two slides are amazing. It's domestic violence in particular is astonishing. Do you think, just statistically, do you think did the police change the way they were grading these? Because I can't envision that domestic violence related calls increased by 80% without a change in the way they were marked by the police. This isn't questioning they probably are. They were probably undercounted before, but this looks an awful lot like. And instead of, I know Bill was talking about repeat offenders, magnitude of changes like this seem to be, more a change in process than a change.
So I can't speak to knowing that there's any change.
I don't know how'd you get these numbers? Or is this they report them to you?
Yeah, so we actually worked directly with police and we asked them to provide us with the metrics. So we asked them for how many calls they received that were domestic violence related calls, for domestic violence, how many calls they received in FY20 and 21, and they recorded these. These are numbers straight from the police.
Yeah.
These are not us going through call logs.
I didn't think it was you. I think I think that they probably something changed. You don't get that
right. And I think part of it,
if I might,
the growth is not there, but they're probably real calls.
I guess if chief was providing the numbers and they changed how they counted it, I would have expected an asterisk. So
no,
I'm more on the side of the glass half full when it comes to this data, and I just put it out there. I appreciate people disputing it, but based on what? What are you basing the discrepancy on? We don't know. Somebody provides us the data. It's either gross
I'll
data.
etch it in stone for you, Jim, that domestic violence did not grow by 80% in 2021.
How do you know that?
You don't
I'm
know
sorry,
that.
By 80% anywhere. It's not like people don't change that much. It doesn't change that dramatically.
Based on what? What is your statistic?
Nothing ever changes.
Trust the science. Where's the science you're referring to?
What?
Sorry,
Go ahead. You guys can chime in.
I was going to offer a perspective. So at least for me, from my perspective, the reason why this number does not surprise me, because I know that sociologically during the pandemic, while people were locked in at home, there was a significant increase in domestic violence and abuse against children. I saw a lot of that, that data published. So that's why I'm not surprised to see that the police is reporting that there was a increase in domestic violence calls during FY21 because people were primarily at home. And that's where domestic violence occurs.
Yeah.
Can I just ask a quick question about this?
Yes, go ahead.
Do we have data before fiscal year 2020? Maybe going back a couple of years before that, just to see what the trend has been on a little longer time period?
Yeah, absolutely. I can provide that data. I don't have that on hand, so I can provide that if that's necessary. Yep.
Well, remember, it's fiscal year 20, which ended in June 30, which is only just starting the pandemic.
Okay, yep. Ed, Amy, you all set?
I am. I just wanted to ask about the longer term.
Ed, are you gonna, sorry, you're muted, Ed?
Muted.
Sorry.
Ed.
So I made my point. I'm just thinking with declining economic circumstances, there's a correlation in increased domestic violence as the economy peters out during bad times. And Tarai made the points I was going to make.
Very good. Don?
Yeah, so Doug, I just can kind of give you a perspective, at the at MGH, the significant increase that we've seen in these types of cases and psychiatric cases, child psych cases, kids staying in the emergency rooms for days on end because there aren't the resources available to address these things. And as the resources, without having the resources to address them, the incidents are going to continue to increase. So
I don't
So I'm
disagree
not
with
surprised
any
by
of you
this.
all are around this. I don't disagree with that it increased. I think the numbers here are presenting it's when you see something that is that market of a change, that is that different than the overall number in terms of domestic violent crime statistics, whatnot, you didn't see this level of spike. So I don't think, look, it didn't grow by 80%. It probably grew by probably a huge amount, 30, 40%. That's a big jump. But it didn't almost double. And that's my problem with a lot of these statistics. We talked about, I'm not going to point out each and every one that I find problems with here, because again, what we all like having numbers. The problem is you're taking numbers, yes, our suicide rate doubled. It was double the state average. I guess it was 4 instead of 2. Not that, look, those are terrible tragedies, but that isn't a huge number. That's probably well within the degree of.
I would hope, I know that's not what you meant, but I hope we're not diminishing the importance.
We're not. That's what I said.
lives.
I'm not diminishing that. I'm just saying that, we're twice the state average, but twice, it isn't like 400 versus 200. It's 4 versus 2.
Brian?
I'm thinking that in the case of the numbers from the police department, I wonder if it would be helpful to ask the chief if in fact there were any changes in the way that they record the numbers, so that instead of just opining about it, we could just find out from the source what the facts are.
Again, I agree, Brian. I think what you're saying is correct, and I would have no issue with talking to the chief about this and having everybody know the answer. But I think I can't remember who said it before, but when they provided us this data and they gave us the explanation, there was no suggestion that there was a difference in recording pattern. But I'm more than happy to talk to the chief about that as well.
Completely understand.
Bill, your comment?
Just to, Anthony, for me, it will come back around to the same thing. How many of those are repeat offenders? So I think that, I'm not asking you to come back before this budget season, but I think if you're in front of us next year and want to present statistics in this way. It'd be interesting to know who are the, is it the same people, going back and back and back, and then it speaks to the overall effectiveness of the programs. If you have the same people keep knocking on the door and, the programs being effective in changing any behaviors. I mean, I kind of hate to say that, but I feel like I have to say it.
No, I absolutely agree. I think you make a valid point. I think we do have to make sure that we're recording or making sure that, high utilizers are counted and they're not, duplicative, and we're not, inflating the number artificially. By no means do we want the number to be this high, but so we will break it out for high utilizers.
Thank you.
Yeah, and I think, go ahead, Bill, sorry.
Right. So Bill, I think we have to separate the effectiveness of the program here, which is primarily referral type services, and the effectiveness of the services available out there in the community to really address these issues. And I think those are the services that we don't have control over that end up causing these numbers to go up that our local health office has to deal with. Because we just don't have the services out there that are available to deal with all these things.
Right. Appreciate your feedback.
Thank you. Anthony, where were you?
Okay. So just to give kind of a summary, there's been questions about how this social service coordinator would fit into, the already existing resources that we do have. And so one of the things I want to stress is, actually it was probably the previous slide, we have great resources. We have a jail diversion clinician. We have a recovery coach that already exists within the police department. And I think those are very useful and very, they're great individuals and they do great work. I think something that we have to make clear is that for something like for the jail diversion program, the clinician in the police department, they're charged with working on cases and dealing with individuals that are actively in crisis. Those individuals, once they are no longer directly involved with those calls, they still have needs and they will, fall through the cracks when they don't have someone to help with the warm handoff to the next resource. And so what we're seeing here is, basically a safety net. What we're seeing is the part-time social worker at the COA. They work primarily with COA clients. They work mostly with seniors. We have this large swath of the general population that still requires assistance. And so the way we envision the social service coordinator fitting in is that they'll work with this jail diversion clinician. They'll work with COA. And they'll pick up cases once those cases no longer fit in the role of those positions. And so the idea is for the social service coordinator to work closely with food pantry. I think the Wakefield food pantry has a great reach into the community. They serve lots of families and individuals. Those individuals that come to the food pantry generally struggle with food insecurity, but besides food insecurity, generally there are other issues that they have that they're working through. And so having our social service coordinator there who will be an expert in all the services that we have available to us and in the surrounding communities, I think it'll be important for them to be able to meet these individuals at the point of contact, at the point of care, and then also, be able to direct them to places that they can receive help. We also see them working closely with the housing authority and housing assistance. I can see them working closely with the veteran services. We have Interface, we have Elliott, and the idea behind all of this is to fulfill the need of connecting individuals to services. It is not so much a direct service social worker. I think it's confusing because folks will use these interchangeably. They'll use social worker versus social services coordinator. We want to clarify that this person would not necessarily provide direct care. They may, in some capacity, provide some specific case management for intensive cases to make sure that individuals, receive the emergency care they need and reach resources and help connect them with family members and help them with that process. But in general, they are really there to help individuals sign up for services, address the language barrier when there is one, make sure that, they can help, give them information about things that they can utilize. just another quick snapshot. We have recovery coaches that they can connect them to. We have employment services, healthcare enrollment, especially for emergencies, something that we haven't touched on enough. Recently, there was a fire in a apartment complex. And what happened was our inspector and our substance use prevention coordinator, these two individuals had to take resources out of their lines of work. Things that they do are very important. They had to take time out to work on, to help place these individuals, have them placed in housing, make sure their basic food needs are met, make sure that their process of going back into their apartments are fulfilled. And I think one of the things that shows us is that, there's clearly a need for when there's an emergency, it can't fall on fire to follow up with individuals and make sure that they get back into their place. It can't fall on just, several positions. It has to be somebody that has a great grasp of all the resources, food stamps, other things that make sure these individuals have resources while they are trying to get back into their home. And just to go over some of the numbers, I think this will be helpful to give context. Just in 2021, we had 39 heroin and general opioid overdoses. 10 of these were fatal in Wakefield. And I think it's important to know that, 10 may not be a huge number, but it's important because these are real Wakefield individuals that are struggling with substance use. And these are folks that, did not make it. And so these are numbers that we want to make sure don't trend upward. We want to make sure that we can do everything that we can to have this lowered. I think another one that's not talked about enough is alcohol. Alcohol has been a consistent problem in Wakefield. We recently looked at the data and we saw that 6.7% of residents suffer from alcohol use disorder. And so I think it's important for us to keep in mind that these issues, along with the pandemic, have just been continuing and potentially getting worse. Based on the state data, the amount of money spent on substance use disorders, that includes treatment and recovery, that includes emergency response statewide, that includes prevention and harm reduction. I think, as you can see right here, based on our population, even though our substance use disorder rates are higher in Wakefield than the Massachusetts average, so this number is a slight underestimate. But we spent $1.3 million on substance use disorders in Wakefield. And this is broken into law enforcement emergency services. They take up half, treatment and recovery are just under half. And so these are precious resources taken from fire and police when responding to these calls. And you can see right here, prevention and harm reduction. These are evidence-based ways for us to reduce substance use disorder and deaths, but they are receiving the least amount of funding. And so what we really have to do is we have to make sure that we're investing in prevention and harm reductions, so that these numbers in terms of law enforcement involvement and treatment and recovery can decrease over time. And this is part of the discussion as well. We're looking to invest upfront on prevention and harm reduction, but what we're really looking at is cost and savings. We're looking at saved cost on emergency services not having to respond to as many cases moving forward. And we want to see individuals be safe in Wakefield, and so this is the path forward. I think this is just a great recap of the way we currently look at it. So primary prevention, there are many things that are already happening. A lot of these currently are grant-based. And so we've been promoting peer-to-peer strategies. The Youth Action Team is a good example. We have school-based strategies that includes different, adjusting the health curriculum to match the current climate. We have, community-based strategies. These are all primary prevention methods. The diversion program, screening for suicides, especially in the school population, and looking to screen with the intention of referral to treatment as an intervention. These are steps to prevent individuals from getting to that point where they are struggling with substance use and they have to use emergency services. And then from the treatment and recovery side, we're hoping that becomes, that does not balloon and that stays the smallest piece, because we have recovery coaches, we have interface, and we have safe project. But these are things when folks have already reached that point where they are in dire need. And so we're hoping to invest in primary prevention and intervention so we make sure that folks don't get to that point. additional responsibilities that our department has taken on in the meantime. We are responsible for tobacco compliance. I think we don't want to understate how important that is, especially in the school environment for our children. I think that's something that we've been working on. That's from a policy side. We continuously revise policies. We work closely with the Board of Health to make sure that we are up to date. And we are looking to see if we can put into place policies that may seem that may be deemed as progressive, but we're looking to prevent, new drugs, from getting into Wakefield and not being addressed until it's too late and it's taken a hold. And so we are constantly doing surveillance, making sure that we know what's out there, what products are out there, and making sure that we know what the risks are and able to communicate that with the community. We work closely with Leahy. We work with Melrose Wakefield, a lot of their initiatives as well. We generally have, our substance use coordinator is the one currently to be flexible and work with all of these things. We also work closely in environmental health prevention. Seasonally, we see vector-borne diseases, we see pests, that's geese, rodents, mosquitoes. These are all things that we deal with on a seasonal basis. These are things that happen in the background. I think it's important to understand that these are still issues that we address. We worked closely for many years with Mass in Motion. This was a really important initiative from the state to address community health and wellness and exercise and eating right. I think these are things that we can't get lost in the, in the work that we do, because when we only talk about substance use and mental health, we also have to address general community health. And when that's, at its best, then we can start making strides. We also work closely with Wakefield Alliance Against Violence and the Mystic Valley Public Health Coalition. We work closely with our collaborators in our surrounding area to make sure that we are, that we're not duplicating efforts. If there are resources out there that we can tap into and utilize and use in favor, for advantages in Wakefield, then we will. So currently, just to give everybody, a picture of how it looks within our department, it's really easy to kind of, hear all this and say, what is the health department working with right now? Currently, I'll start with my position. I am currently 0.3 FTE. I am split with Melrose right now. I serve both departments. Our senior health inspector is currently 0.5 FTE. They split evenly between Melrose and Wakefield. Our public health nurse is the same situation. They split between Melrose and Wakefield as well. We have 1 FTE and an office administrator. Our DFC grant coordinator, who does much more than just this drug-free communities grant. They were directly involved with many emergency responses, along with our senior health inspector. Emergency responses to fire, to displaced individuals, to other cases of housing complaints. These are all things that they have been involved in. We have 1 FTE that is fully grant funded right now. And our youth coordinator, that is a half FTE, and they work closely with the schools. They work with youth action team. And so, just with these limited resources, we have been trying to keep up with the demands. And in some places we have fallen short. And I think it's important to understand that, again, to recap, we're not looking to become the service provider. We are just looking to become the best social service connector that we can be for the community and utilize existing resources. That's it. Thank you.
All right, Anthony, thank you. Any other questions, comments? Bill?
Yeah, just one question, Anthony. As you look at, and again, we've asked you to come back with a lot more information because, albeit, you're a small department overall, the increase was, larger than, we see in other areas. So appreciate the effort and time you put behind this. But as you're looking forward, fast forward a year, is there more headcount you contemplate coming back for next year?
Are you asking if we're going to be requesting more headcount next year?
Yeah.
So I'm not going to commit myself one way or another. That's dangerous. But I think right now what we're looking at is the minimum. I don't think we need to ask for any more. We will come back next year and bring you the metrics that shows what's been going on. I don't anticipate having to ask for more staff because we are looking for grants. We are using this opportunity to look for grants to fund other positions that would not fall within the town purview or town budget purview. And so that's how we're going to continue to do this work, is that with this, basically what we're looking for is, an investment. We will be able to use this time to look for more grants to support our operations.
Okay, thank you.
Doug?
So, Anthony, is this current staffing chart the one that you're with your new people, or that's what you have currently? That's
what we have currently.
Okay, so the new, you're essentially adding 1.5 staff, right?
So we are looking to add one, we're adding a half health inspector, we're adding an additional half public health nurse, and we're looking to add one additional social service coordinator. So that's two,
2.5,
I believe.
2.5.
2.5, yeah.
2.5 is what you asked for. Yep.
Yes.
Right, but one is being transitioned from a grant to us paying for it, sort of, I'll use the safer grant methodology for.
So that's the DFC grant coordinator you're referring to, and that's going to be a half funded by DFC and half funded by the town.
Right, and then where the DFC coordinator is moving into an administrative position, right? That was your
The half is, yes,
coordinator. Yeah. So, and then I guess the only thing, getting back to the health inspector, if we're hoping that they're going to do 300 and they only did 85 and as a half-time employee, like, is it reasonable to expect 300 out of a single full? I mean, I guess maybe were they able to do more in Melrose? And I got to assume that the number has to be even higher for Melrose because you have more restaurants.
We actually have more restaurants in Wakefield than we do in
Really?
Melrose. Yes.
That's hard to believe.
Well, I mean, the hard thing was figuring out like all that catering. Like, I didn't know that like there was that much catering.
Well, those are businesses that also do catering. Those are businesses that we're using catering as the example for level 2. Those are establishments that also serve hot food. They may not be working with raw materials. So catering was the example, but they don't all do catering.
Okay. And by the way, I mean, I know I've busted your chops here a lot tonight. To be fair, the increase here is dramatically less than the increase that we gave to the police in terms of dollar value. And, and frankly, a 6.5 number on the police is decidedly less sustainable than a 38% on the health department, especially since it sounds like, I think when the police did theirs, they were also citing some of the same additional burdens faced by y'all. So, Steve, I'd be happy to go along with this if you can get me some money out of the police.
I think these are the most important things we're going to do right now. Great job, Anthony. Fully support.
Doug, you good?
Yeah.
Thank you, Mr. Butler.
Thanks, Doug. Dan?
Yeah, a couple things. One is, thank you, Anthony. This is extremely eye-opening. It's clear you guys have got your work cut out for you, and I am not surprised by the increase in the domestic violence calls to the police. I think I made 30 of them myself for my cat. But the thing that I actually had to smile a little bit back on slide number 3 when we were going through the food establishments complaints, and you said without a pause, employees eating rodents. And I thought, oh my God, there's employees eating rodents. That's really sad that they've gotten to that point. But again, thank you. Good job.
Nice catch, Dan. Nice catch.
Yeah.
Thank you. I can guarantee no employees were eating rodents this year.
Oh, good. Thank you.
Go ahead.
Good job.
Go ahead, Ed.
I just want to thank you again, Anthony. I certainly want a copy of this presentation if you can send that to me. Just a general comment is I think that the pandemic exposed a lot of management deficiencies in many cities and towns in both public health and emergency management. And it's forced folks to relook at all of these functions. I know I'm doing that in Somerville right now, but I think this is a worthwhile investment. I think it's very important that there is coordination, a consistent response, coordinating the social service agencies in the city of Melrose and Wakefield is very, very important. And if you don't have that support, where do folks go? They run to the city hall, the town hall, and it just creates a bureaucratic nightmare for all. So I appreciate all the detail here, and any concerns I had before are allayed, and I certainly support what you're trying to do.
One last thing, Jim, don't flip those words, employee eating rodents and rodents, because it could be rodents eating employees. Dan would be more horrified with that, I'm sure.
Yep, that would be another difficult thing to try to explain on the front page of the local paper.
Hey, Jim, can I just, there were a couple questions asked, and good thing is that the police chief does answer my texts right away. They have not changed at all how they categorize anything. So those are apples to apples comparisons in the domestic violence reporting, which is not surprising, as I think a lot of us have said. As far as Mr. Boudry's question regarding, is it the same people or there a number? Are they new people? We do have a lot of the same people that come in, but there are an awful lot of new as well. And, earlier this year, the interface program, which we referred people to, actually stopped taking new clients for a couple of months. So it's there's a strain on the whole system, and I certainly appreciate everything that Anthony and his staff has done. And hopefully, if we can prevent some of these in the beginning, we can also save some money. Last thing I'm going to say on this is that we do have another sizable opioid settlement that we just settled that is going to bring anywhere between 40 and 50,000 a year into these exact services that can help lower the burden on the tax levy. And we still haven't got the Purdue Farmer settlement. So there's some other funds coming in here other than tax levy.
Okay.
Thank you, Anthony.
Thank you.
Yeah, Anthony, thanks for coming. Appreciate the efforts, and thank you. Steve,
Mr.
thank you for
Chairman, now
putting this
that the
together.
battle's over, do you want to give Frank Leone a chance on
Yeah,
capital?
I
Do you
was
mind
going to
jumping?
suggest that, okay, with the group, Frank's the only other person. There was somebody on a cell phone, I mean, on an iPhone, but I'm not sure who that is. But yeah, Frank is here. I'd prefer to move. What we would do, Frank represents the capital. So if it's okay with the group, Frank's going to review the capital information. I can share if you'd like. The presentation you just saw was in the within the link I sent, and the capital outlay approval list is also in the link. I'll be glad to share mine, or if you want to, probably easier for me to share, or Frank. What do you want to do, Steve?
Can you share? I don't have it. I don't have it.
I guess you got to share, Jim.
Sorry,
Yeah,
Jim.
that's fine. Share, Jim. How does he share?
Jim, while you're doing that, I'm the iPhone that dialed in because I had to switch over from my computer audio to my phone
Sure.
audio.
Great.
Jim, you should be able to share now.
Thank you. All I gotta do is find it. Capital workbook. Is that legible? Do I need to zoom it up a little?
That's good.
Yeah, that's good.
Great. Frank, you're up.
Okay. I'll go. Hi, everybody. How you doing? Hopefully next year we can do this in person again. It'd be nice. We have Jim, you're in control of the sheet, so
Wherever you want to start,
I'll
Frank.
go through it. I'll go through that so you don't have to keep going up and down. But the total this year that is requested is $2,100,000. No, keep it up there, Jim. That's all right. I'm just gonna go. I'll go through a couple of the big items. You see a John Deere loader on there for the full $270,000, and there's a utility body truck for the DPW for $115,000. The big thing to mention with these two items is that we're putting the full amounts in the funding this year, and we're not leasing them. Usually for something that big, we would have to do a 3 or 5 year lease so we could get more items in. But the committee felt like we're doing so well with this that to get to this point at the 2.1, we could keep this in there at that. And this year we did not actually add to any of our leasing money. And I think that's a great thing that we did this year, especially with an item. The $270,000 for a loader that's a big amount to have all by itself in 1 year. I'm just going to throw some numbers that you don't have on here, Jim. For the next 3 years, our leasing number is going to carry the same as it was this year, at right under $250,000 before it drops off. And one of our goals as a committee is to get that. If we have this amount of funds available to us every year in the $2 million range and up, we're hoping that we don't have to do the lease at this point because we've been doing so well lately. So going down the list a little bit more, we have the usual cruises for the police force. If you notice in there's a police transport van. We usually do 3 cruises a year, but this was a different year that the chief only requested the 2. And if you remember over the past couple of years, maybe 5, 6, 7 years, they've been asking to replace that transport van. And it's just in addition to 3 cruises. So this year he presented it as one of the cruisers and we were all okay. We thought it was feasible to do that this year. So that's why it's in there. Scroll down a little bit, Jim, on the list. There's a lot of building renovations. The town hall has a lot of stuff going on, and it's a lot of stuff that's well overdue, and we're getting a lot of it done this year. With Joe, obviously Joe's guys, Chris, the buildings coordinator, getting a lot of this in place. If we can get a lot of this done this year, that building's in good shape. And you'll see the 5 Common building in there as well, a little below that, and 11 Lafayette. Those are the buildings behind the town hall. We've been trying to get a lot of funds the last couple of years in there to keep those buildings up to par. And they're in pretty good shape. We all took a tour of those 3 buildings this spring, and just to get firsthand, sight of everything. A couple going down a little bit further, the Civic Center has a couple more items that we've been trying to keep up on the Civic Center as well, because we all feel that that's a special building in the town. The roof is gonna get done. There have been issues over the last 10 years when it was done last time, and we had to supplement a little bit of funds to make sure that it could be replaced this year. And then some bathroom and mezzanine renovations that weren't too expensive. Looking down the list a little bit more, there's nothing to the BB library, the carpets. I think it was last year or the year before that we had to cut it out because of some other changes. So we gave them a big lump of sum this year to make sure that they could get all those first floor carpets replaced that were damaged. In the field section, so the Walton School, the last couple of years, if everyone remembers, we've been trying to do a playground a year. And it's been working out well. We obviously missed the pandemic 2 years ago. We had to push it off, but last year was the Woodville. The year before was the Greenwood. The Greenwood's all done. So if you drive by there, you'll be able to see that. The Woodville is going to be done this spring. After school's out this summer, summer after school's out, because Woodville's kind of a tough area to build in while school's in session. And we've been kind of asking to see if we can get the Walton done this summer too, but that's obviously scheduling stuff this year. Getting anything delivered is tough this year, but hopefully that'll be done sooner than later. We have another big item in there is the aggregate screener for the DPW down the pit. There's a lot of material that gets put down there, and they spend a lot of money exporting it and disposing of it. With this screener, they can use this to sift through it and possibly reuse a majority of this. Joe could speak more to this if you wanted to ask him, but we all thought it was a great investment. And
Yeah, and I meant to say, Joe Conway's on. He helps work with Capital Group as well. Not to slight Joe, thanks.
we work around Joe. Joe is the Capital Group.
This is facility.
And those are the big items. If we scrolled by anything that anybody has a question on, I'm sure if I can't answer it, Joe can answer it. But our request is obviously $2.1 million.
2.1 for the everything non-enterprise related. Yep.
Jim, could you scroll to the top?
Yep.
So the fleet, is that all replacing existing assets? I think maybe you said that, Frank, but I just.
Yes, everything is always replacing. Sometimes, so in the past, Joe Conway has put in there the year of the machine we're replacing, but we always get funky questions from the town meeting. But this year he placed in there 2022, which means we're purchasing a brand new items. All
Okay,
those are gonna be brand new.
Down below, I think in the water or sewer, Jim, if you can scroll back to that.
Yep.
There's a Bobcat there. Why wouldn't that be included with those?
So anything in the sewer and water division, they're funded by retained earnings from the water and sewer. So even though we have to approve those numbers, it's technically not coming out of the tax levy. Did I say that right, Joe?
Yeah, so Bill, it's just a different basket of money. Think of it that way.
Okay, is that replacing an existing asset also, or is that net new?
No, that'd be replacing the existing one. I think that one is like a 1995 or 1996.
Okay. Could you just say a little bit more about inflow and infiltration reduction? What is $500,000? What is that?
That is a program that we do every year. Bill, in your neck of the woods, you've probably seen them on Vernon Street when the manholes are steaming. So what that is we camera inspect all of our sewer lines. And while we're in there doing that, we find areas where there's cracks and different things like that that are allowing the groundwater to get into the sewer system. Once we discover that, we can then line the pipes from the inside and essentially create a pipe within a pipe. And what the goal is without having to dig up the street, we can structurally line our sewer, but then we're also eliminating flow that doesn't belong in the sewer anyway, that we would end up getting metered for and then having to pay in our sewer assessment. So I've said a few times, I'll probably continue to say it, we've done a heck of a lot of this because the MWRA offered grant funding where they would essentially give $1 million loan for 25 cents on the dollar. We used every available stage of that loan that's offered like that. There's one stage left, and it is a straight $1 million loan for 0% interest over 10 years. Because we had the retained earnings to be able to do this this year, that $500,000 will essentially pay for another construction season. We'll be able to continue our program, and we won't have to exercise that loan in hopes that they continue the grant funding, and we could take advantage of the cost savings that is provided us.
By doing the pipe inside the pipe, does that effectively sometimes mitigate full water main replacement?
So this is sewer related, but yes.
Oh, okay. I'm sorry. Okay, got it.
Right, and the intent is to what Joe explained is you're not getting sewer in the sewer pipe, you're getting groundwater in the sewer pipe, and then it goes by the meter at MWRA, and they think it's sewer, and you get billed for it, even though it's not. So any of this excess water you prevent from getting in lowers, what's going by the sewer meter.
Okay, thank you for those clarifications. Thanks.
Yeah, so this will do that for both pipes, and then it also seal manholes too. So I think some of our infrastructure out there is a brick manhole that was put in 40 years ago. Essentially, it's accomplishing the same thing.
Sure. Any other comments on the, do you want to just cover the sewer and water? Any other thoughts on this? I know Frank didn't cover it, but.
I could just run through it really quick. So we talked about the Bobcat. We need to do a little bit of work on the HVAC system at our Farm Street pumping station. That's at the corner of Farm Street and Water Street. That is the last step before everything gets pumped towards Deer Island. Every year annually, we do a system improvements article for $100,000 in sewer. What this is those unexpected times where we're doing our camera investigations and we find out that slip lining the pipe from the inside isn't appropriate. We do have to put in a couple of lengths of PVC or something like that. So this just allows us to do that. Obviously, we talked about the inflow and infiltration, and then at some point in time, probably post 4th of July, to get ourselves ahead of what may be coming with the Envision projects downtown. There's a sewer force main on Spalding Street, runs from basically where the ice cream truck used to take post to the intersection of Church. We're going to look to replace that and get ahead of any other infrastructure improvement that's coming down the road. On the water end, we need a pump for one of our pumping stations at Linden Street. We have some tanks and pumps at our treatment plant that need replacing. On the water side, we also do some system improvements. What this usually pays for is replacing fire hydrants and water gates that we find either are inoperable or need some attention because of age. And then we also have a $500,000 line here for water mains. This is going to cover a 12-inch water main on Eaton Street that we have a pretty bad break history on, as well as provide a little bit of extra yet to be determined. We're waiting on a water bid that is going to open next week to find out exactly how far we're going to be able to stretch that.
Okay, great. Thanks, Joe. Dan?
Yeah, thank you, Frank. That's very good. And Joe. So I've got a couple of questions. I'm trying to understand what we've got here. On Town Hall, the siding replacement, as I recall, Town Hall is a brick. So is there an addition or something that we're talking about for siding?
There is the back side where the building inspector's office is, and then essentially the alleyway between 5 Common and Town Hall. Believe it or not, is actually aluminum siding.
It's aluminum. I wondered if it wasn't aluminum. So that's your section you're going to replace.
Yeah, so that'll be replaced. The siding will be stripped and replaced, and then we'll cover it in either 3/8 or 1/2 inch insulation roller.
All right. So, and then moving down the list, the public safety building, the fire section, windows and VAV replacement. Now that is, I know, what, 15 years old now in terms of but are we replacing an entire window? Or I mean, $9,000 doesn't seem like enough to replace a bunch of windows, or is it just repairing some windows?
No, these would be windows in the administrative side that are not picked up in any of the renovation project that's happening. So
okay, so these are very, very old windows rather than those that replaced when we redid the fire department.
correct. And then the same thing with the VAVs, those are not getting touched as part of the building renovation, but our HVAC folks discovered that they're getting pretty close to the end of their life, and if there's a time to do it while they're doing the work, we should get in there and do it as well.
Okay, and I think I already know the answer to this, but you got the Wakefield High School for ceiling tile replacement. I gotta believe it means that it is so bad you can't wait a couple of years to replace them when we have a new building.
Exactly. This is more of a experience of quality of, not quality of life, but quality of your time there type of thing. Literally the ceilings,
Okay.
bubble gum and band-aided together, and it needs to go. I don't think if we had our druthers, we wouldn't probably put any money into this knowing what's coming, but unfortunately there are a few things, and those kids deserve the best experience they can get.
Yeah, and on the Galvin, this is another one. We have a relatively new building, and I know we've had to replace, I think sinks or something a little while ago, but door handles. What's up with the door handles?
So these are for the doors that are on the north-facing side. So the ones you would enter in for town meeting. What the problem is with these is the mechanics that function, the strikers and things like that, are internal to the door, and they see so many people coming in and out, they're wearing them out. So what this would be is to retrofit those and make the mechanics of the door be external, so that there's a problem, we can fix it without having to get somebody specialty in there to replace the guts of the door.
Okay, got it. And then I I think this is my last question. It has to do with the IT section. And I know that library is kept up on stuff and they do a rotation and they do a really good job in IT. But there's nothing for the rest of the town? I mean, are we doing a rotational, like, for example, town hall, or is that in a different budget? I was surprised it's only library.
So Todd gave us all of his IT needs, like any of the other department heads. He's pretty good at investigating ways into different grants like community compact and things like that. I know they just went through town hall and we're doing a round of machine upgrades. But if memory serves me correct, this year is a pretty light request for Todd. He'll probably be back in next year with something more.
Okay, right. I'm sure that our IT department is not ignoring town hall or DPW or anybody else. I was just surprised that only library was listed.
I think he might be hitting some of those in operational too. rather
Yeah,
than-
I
I
was
was
gonna
just
say,
gonna say,
that's,
doesn't he replace PCs and so forth through the
Right.
operational budget?
Yeah.
yeah, okay, so we're splitting IT in a couple different sections. All right, good. Thank you, Joe and Frank. I'm good.
Very good. Ed?
Joe, good work in terms of using retained earnings. We're talking about the sewer division, retained earnings, as well as the MWRA zero interest program. That's great news. I'm just curious to find out whether you are looking into for the future some of this substantial federal money coming down to the state. In the last infrastructure bill, there's a lot of sewer water type of money coming down from the feds. I didn't know if you were looking at that for the future.
No, absolutely. So when the town is ready to have that conversation, we have a list of things that we'll certainly be asking for. What we'll try to do is take the approach is to take some of the things that might be a little bit more burdensome related to bonding and things like that and accomplish that so that, our operating year after year, we can handle the things that are, plateaued and won't cause rate spikes and different budget fluctuations. But I can tell you when we're ready to have that conversation, we're certainly going to have
Sure.
pretty substantial ask in the background to try to put us in the best position for everybody to say yes.
Right, and we'll have to get our hand in early to be competitive against other communities as well. So there was a fairly substantial rate increase this year. I know we talked about the rate study and whatnot. Where do you see operations going this fiscal year in sewer? Do you expect to have retained earnings for the next fiscal year?
Yes, so at the last certification, both enterprises were certified at approximately 1.8 million, including this expense and assuming that the budget is spent to the maximum and we don't generate anything more. We expect the balances to be somewhere between 850 and $1 million still at the end of the year.
Okay, and generally you're not going to spend to the maximum,
No, not at all. So the whole time, at least in my tenure here, my goal and my staff's goal is to try to mimic the enterprises like the town. So what we'd like to have is the retained earnings budget at the end of the day be somewhere between 7.5% and 10% of the operating budget.
Great. Okay, thank you, Joe. Good work.
Welcome, thank you.
Very good. Doug?
Oh, I think, sorry. I guess my only question was, and I think I probably asked this every year, that whole GIS application services 130,000 on townwide. Is that like geographic mapping or some such thing? And software for that?
So we have the software. Basically what this is in 2019, we came in with a 3-year plan that got a little bit off track because of the way that the world ended up. But what this is taking all of our assets that we have on paper, essentially, and digitizing it so it's backed up. And this is the last of the funding that we requested initially to complete us and give us a baseline to be able to keep up with it. So our GIS department is one person. So this is something that is going to help that person be able to, tread water and not get too far behind with keeping our assets up to date.
Okay.
You good, Doug?
Yeah, I think so. or do we think that ongoing, we're gonna have this, like, is this an ongoing, should it stay in capital or should it just be a?
No, this is basically just a shot in the arm to get us at a pace that we can sustain and become an operating pig for us every year.
Okay.
Very good, Joe.
Yeah, thanks, Jim. Just to let you know, the subcommittee met with the capital planning committee last month. And their last day of voting, we went all throughout their process of getting their spreadsheets. They started with about 3.5 million, around somewhere around that. And the only issue that came out was there's some questions about a definition of what is capital versus operating. And we were able to decide that some of the commissioning for the recommissioning at the schools is actually operating and not capital. So that was taken away from this. So, and just to let you know, I thought that the Frank and the capital planning committee did a great job in this year's work. Thanks.
Very good. Thanks, Joe. And I'm sorry I didn't call you forward.
Don't worry about it.
Discuss.
Right, all right.
Thank you. Was there any other comments for the capital team?
So Jim, I wanted to, I quickly just not drag on too long here. Going on Joe's comment, on comments, we had, this was the first year we've had a full 7-member committee since I've been on the committee for over 10 years now. And it's a lot of educated people. They're very smart. And I agree. There's a lot of great questions asked to the department heads when they come in. It's a great committee, but I won't linger on that. One thing the committee did want me to throw by you guys is just for the last, I get some numbers in front of me here that Joe Conway presented to me. Over the last 7 years, we've been hovering around the 2 million mark for the capital, except for obviously the pandemic year where we had to cut it in half down to 1 million. So, from 2015 on, we 2 million, 2.1 million, 2.1 million, just under 2 million, 2.14 million, and then the million in 2020. And then last year, 2021, it was 1.98. And just to put that in perspective, in 2015, almost $700,000 of that was in leases. So that obviously limits what the new capital budget is going to be. And I had mentioned at the beginning that we're trying to get that lease number down to nothing. It's a great way to throw more items in the budget by obviously spending less in that current year, but it spreads it out obviously. And that's one of our goals for the next, for upcoming. But we, if need be, obviously we're at 2.1 this year, which is close to as much as we've ever been in the last 7 years. But we're hoping for, an annual increase, and if need be, to use it. We don't want to be spent, maliciously, but just have the 2 whatever million and just make sure we spend it to the top. We don't need to do that. We proved that in 2018. I know we didn't hit 2 million because we didn't need to. We had everything covered. But obviously there were some leases in there. If we can do this like this year, get to 2.1 and have almost, $500,000 for 2 items, 2 or 3 items that doesn't have to be leased. I think that's fiscally responsible for the town, as opposed to, keeping it down to 1.5 million but spreading it out for 5 years. So the capital committee would appreciate the support of FinCom with, if we had to increase by, 2, 3, 4, 5% per year for the next couple of years, if needed. But I just wanted to throw that out there to you guys.
Thank you, Joe.
Yeah, Jim, sorry, Frank, I forgot to mention that.
No problem.
That the capital planning committee made a point of that they would like to see that we have in the years going forward, that they have some gradual increases percentage wise on their budget. And I think that it makes a tremendous amount of sense.
Okay.
Thank you.
Great. Dan?
Yeah, I'm gonna echo what was just said in terms of the capital. I just pulled up that little graph that I do at, showing capital expenditures both as a dollar amount plus the bonds, and also dollar amount as percentage of our total budget. And as a percentage of our total budget, we've been hovering between capital and capital bonds at something between 7 and 8%. And I believe that some of the guidelines or best practices and so forth say that we should be closer to 9 or maybe even 10% we spend on capital. So I concur with Frank and Joe is that we should be spending a greater portion of our budget on capital than we are today. I mean, it's a lot better than it was 10, 12 years ago, but we still have a ways to go. So for 2023, I'll be looking for an increase on a 2.1. I mean, 24.
Great. Very good. I don't see any other hands. My only comment would be, I love the discussion, Joe, about what's capital and what's operating. Been beating that drum for 10 years or so. So thank you to the team. All right. I think I don't see any other questions. I'm going to stop sharing this. And thank you to the Capital Group, Joe and Frank. Take care.
Thanks, everybody.
Thank you, guys.
See you, Frank.
Okay. We have, going back to the groups of budgets, if we want to start, under item number 4, it's cable television. Then there's an item for group health insurance and group health insurance subcommittee report that would be associated with that. Steve, was that the intent on the agenda?
Yes. Yes. Yep.
Okay. Sorry, with the group, we'll go back to the agenda and look to do the cable vision. Kevin's with us, I believe.
Yes.
I can share once I find it, but isn't much to see, but go ahead, Kevin. Thank you.
The cable TV access enterprise account, we're recommending an increase to this budget of $55,266 over the current year. This budget is funded from receipts from our cable provider, which is Verizon, Comcast, and RCN. This budget is based on both prior and current year estimated revenue. The revenues have been trending down. If you see on like under personal services and contractual services on the second page there, revenues have been trending down about 3.75%. The reason that this budget is up, we just renewed our Verizon contract, and for the first 4 years of the contract, we will be getting additional capital money. We'll be getting an additional $37,500 each year. We just received the first check, and we'll also receive a second check this time next year. So the capital was increased 75,000, which is the 2 bumps, one for the money we just got this year and for the additional funds next year. The total budget request for fiscal 23 is $606,505.
Very good. Questions, Ed?
Yes, Kevin, maybe just for my knowledge, WCAT, is that a town-run function or is that a private nonprofit?
It's a 503C.
Okay, all right. So I see we're also funding personal services. That's the school system, I take it, correct?
That's correct. When the money's come in from our 3 providers, there are three channels under cable access.
Right.
And it's split 1/3 for the school department, 2/3 for WCAT as the funds come in.
Okay. And you're accounting for this through an enterprise fund, I see.
That's correct.
So if, when we say personal services, if there's staff, town staff in the school department, I was just curious, and we'll get into the health insurance. I didn't see a capture. I see, a capture for the water and sewer enterprise for.
Right.
Are we capturing any monies from this enterprise fund for health insurance and other benefits?
No.
Should we?
Where historically we haven't
Oh.
Same thing with the school grants that it's usually picked up on the town side.
Okay, it's a fertile source of income in school grants, but just in my view, and that's, if you've got like Title I or you've got benefit monies coming in on these grants, I just think it's something to consider trying to capture,
Right.
just the burden on the health insurance budget.
Sure.
Yeah, and revenue is going down. It's people cutting the cord also. It's really the big problem with a lot of these cable providers. Okay, thanks. Those are my questions. Thank you.
Okay, thank you.
Okay, that was it. You want to, so group health insurance, and the subcommittee, want to have a subcommittee update from group health, if someone is available to speak to that.
Nope, Don is still on the line.
Sure, I can speak to it. So the subcommittee met to review the group health insurance budget. At this time, it's going to be about a 5.6% increase. The increase is driven primarily by an increase in the of 10.3% in the always, which is the most heavily subscribed plan. The other plans, the Medicare plans, increased at a lower level of 1.2 to 3.9%. So, and Fallon is leaving the GIC, so there'll be about 30 individuals that will need to leave and move to other plans. They're budgeting 16 new participants in the plan. And the last thing is the OPEB contribution is going to be lower than previously. So we're reducing it to 1.4 million in FY22. And if necessary, after the reevaluation this summer, we can come back in November to update the OPEB. So there was some mid-year adjustments that were made to the staffing that resulted in some personnel increased costs. And in past years, this budget returned approximately $300,000 to the general fund. We discussed briefly if there is that available money to the general fund, whether it made sense to move it to OPEB rather than return to the general fund, but we decided to hold off on making any recommendation on that. And finally, I think, there's a hope that we'll be able to move folks to lower cost plans, but always, even with the level of increase, is on the lower half of the plan costs. So I know there's optimism there, but I'm not sure that as in past years, that we'll be able to achieve moving a lot of people from that plan to other plans. And that was it.
Okay.
This is Dan. Just to follow up on what Don said on the OPEB front. Although we're lowering the appropriation from 1.6 to 1.4, our assets are invested with the PRIT fund, and over the last couple of years, they've returned around 20% per year on those assets. So we've done really well on that score. And on the liability side, our assumed increases in healthcare costs in the valuation are greater than what we've actually seen. So I don't have an issue with lowering it to 1.4 until we get a new valuation from Siegel, because I think we'll be able to put in less money, for at least for 23, and we'll see about 24. So I thought it was the right move to lower it to 1.4.
Okay, thanks. And it just, I put up the GIC. It was in the link I sent, just as an FYI, shows you some of the new plan costs and so forth. I don't know if you can see it, but that was in the within the link. And I know Kevin will probably review the budget, but Ed, go ahead.
Yeah, just a couple of questions. So the town has different percentages split between town and employee by plans, not across the board. Is that the case?
Correct.
Okay, great. I'm just curious about the opt-out incentive program. How many folks are taking advantage of that, and what are you paying out? That's a great idea, of course.
$160,000.
Yeah, 160.
Great.
Yeah.
I'm all
And
set.
they have to have an on our plan already.
Right,
So someone can't
exactly.
just sign up for the town and say, oh
Right.
yeah, I'm gonna opt out. No, you have to be here for a while.
Exactly. Yeah, that's good. That's great to hear. Thank you.
All right, Don, thank you. Kevin, you want to review the budget?
Sure. Group insurance budget, we're requesting an increase to this budget of $920,367 over the current fiscal year. The weighted average of the increase overall is approximately 8%. The tax levy portion of the budget is being increased $691,843. The increase from the enterprise fund is $228,524. As mentioned, we did decrease the tax levy portion of the budget by reducing the OPEB $275,000. Currently, our OPEB balance stands at approximately $25.5 million. We did increase the MLD's admin expense on page 2 by $25,000. I don't know if you remember when Todd was in with his IT budget. Todd was going to be doing some additional work for the MLD, and this is where we capture the additional expense. The total budget request for fiscal 23 is $15,205,320, with $12,958,885 coming from tax levy, $450,471 from the water enterprise, $312,013 from the sewer enterprise, and $1,491,951 coming from the municipal light department.
Can I just add a couple of words of context, Jim, if it's okay?
Oh, very good. Good. Thanks, Kevin.
For some of our new members, we entered the GIC in 2012, and it wasn't an easy sell to the employees. Thank God there was a change in state legislation that allowed to get us through. We did join the GIC at that time. In 2012, our tax levy portion of health insurance was approximately $14 million, and there was no OPEB funding included in that. So this year we're at $12,950,000, and that includes $1.4 million for OPEB. We have an OPEB balance of $25.5 million. Real great story and great work by the staff. Great support by the Finance Committee and the Board of Selectmen at the time, who I think I made them meet on July 5th to jump right in on there. They weren't too happy, but it was millions of savings. So it's worked out really well. And for the most part, I think the employees are okay with the plan. It's not as good as Blue Cross Blue Shield, but nothing is. But I think it's worked out well for everybody. Thank you.
Great. Any comments on the
I
group
can't believe it's been 10 years.
I know. We used to wear buttons that says "Got OPEB," right, Dan?
Yep.
And here's Brian
Yep.
Cusack. I think he had them too.
Yep, I still have my button.
I do too.
I have mine.
Okay. Medicare budget?
Medicare budget, we're requesting an increase of $41,630 over the current fiscal year. This budget is used to pay the town's portion of the Medicare tax, which is a salary-based tax for employees hired after 1986, at a tax rate of 1.45%. Total budget request, $874,280.
Very good comments on that.
Are we gonna need a reserve fund transfer this year?
I hope not. No, we should be. If we do, it's gonna be minimal.
Okay,
Okay. We have the DPW, it looks like, right?
Yes.
Next. And I don't think I have that open, but I can get it real quick. So. You gonna cover that, Kev?
Sure. What I'll do is, we've already gone through the DPW budget.
Right.
I'll just go through what the changes were. We increased personal services on the operational budget, $76,761. We settled the laborers contract. We increased the sewer budget by $17,978. Same reason. And the water was increased $22,493 for the same reason, the settlement of the contracts.
Very good. I just have the summary page up for reference. The comments that Steve had put out, I sent to you guys as well, covering the same items. So any discussions about that? Is it the standard like looking contract for half now,
Standard,
half later?
It's cost of living increases of it's a 3-year contract. Cost of living increases at 2.5% per year. Contract begins July 1st, 2022, ends June 30th, 2025. There are 2 new steps at the end, at the final end at 1.5% each. We were really looking to retain our longer term employees to do that. And there is increases for stipends for accreditations and certifications, trying to reward a better trained and workforce. And not to talk too loudly about, but I did bargain out seniority on all promotions, which is huge in.
You bargained out seniority.
Yes.
Can you repeat that?
The seniority is no longer a factor in whether you get promoted or not. It's qualifications,
That's what I thought you said. Okay.
which is
That's
pretty
great.
big in,
That's great.
that's
great.
pretty big in a municipal word, right, Ed?
Oh, it's killing us in Somerville, believe me. Yeah.
Excellent.
Very modest, very benign, actually.
Yep.
All
Okay.
contracts on the town side are settled now.
Yep. All right. Bear with me. That completes the budgets, I think, Steve, right?
That does.
All right, I wanted to just show one thing, if I could. Let me find it. So before we get into the articles real quick, so I had asked Steve to put together full-time equivalent additions for this fiscal year. Again, it was in the link I sent, although I didn't quite highlight it, but so we were talking, a few weeks, a month back, where there was a health group, with the FTEs that Anthony had proposed, that Steve had proposed. And then the schools came in and the school numbers, I was involved in that, so I knew what those numbers look like. And so those were quite a few numbers as well. So I asked Steve and Kevin to just give me kind of the breakdown. How many new people are we hiring? So as you scroll down the list, it isn't that all glamorous, but building is 1 and Board of Health total is 3. So the schools, so the whole town departments, it is what did I say, 4, Steve? Is it 4?
4, yeah.
So there's 4 additions, in all the town departments. So you know, I hadn't really been keeping track of it. I didn't have a game sheet, so I thought this was helpful for me. So, you know, I was kind of in general, that made me feel pretty good. The schools, you know, 13 additions, 9 on tax levy and 4, you know, getting covered at least this year by other means. So the grand total additions was 17, you know, 4 from the town and 13 from the school. So again, you may all know that. I just was kind of trying to reconcile it in my head, and I knew Kevin could do it easier than me. So my takeaway of that is, you know, at least the town government, there aren't a lot of additions. School department, there's a lot of additions. That was my takeaway, simple math, looking at it sort of objectively. So as we talk about budgets going forward, and the Board of Health, you know, definitely has those increases we talked about. But overall, 17 new heads, and I think on the budget for the health insurance, you were showing like 16 new potential people on insurance to be determined, but that was based on this, I would assume, Steve, in general.
Some of them we knew about and accounted for, so that would be
Yeah.
16 additional, yeah.
Yep. So anyway, that was FTE or additional bodies. Certainly a pet peeve for a lot of people in the group, and you know, hiring and why we're hiring. So I thought that was of interest. So anyway.
Hey, Jim, I'm confused. Like how's the police, and there was another budget that was going up 6 or 7%. How are we doing that without new people? Or what? Like how?
Yeah.
I'm confused there because I feel like there was some sort of grant. Like I feel like in the police and fire, there's often some of this grant nonsense that gets sort of meshed around.
Well, in the police, there was return of some items, return of the 4th of July item, which he had taken out the last 2 years. So that was 38,000 of that. There was an increase to the holiday pay line item of 87,000 because of an additional holiday, and that we had historically underfunded it. We also increased contractual services for the body cameras and the storage of that. And we removed a COVID offset used to help the mental health clinician. So really, when you pull those out, it was the addition of those articles, not so much new FTEs.
That last thing you threw in there, what was that? That was the mental health people?
Yeah, we had used 18,750 of some COVID money to offset the mental health clinician, and we just pulled that out and just had tax levy cover. No, that was a portion of the salary. I forget what that was. Half of it, Kevin, or a third of it?
I think it was like a third.
Yeah.
I forget. Is the mental health clinician part of the health department or part of?
No, that's the police one that goes out on the actual. Yeah, we don't have mental health clinicians in the.
We have a mental health clinician on the police, but we're at.
Well, we talked about that. I asked that question when we met the first time, and given that, you know, was, you know, heading up the police department budget, that we have assets there, and I think time will tell about how those assets are deployed with the health department. It doesn't seem to make sense that they're in 2 different places, but I think that needs time to work itself out.
Okay. I don't know. Anything else on that? So I guess, you know, my takeaway, I think 17 is a high number. That's just me. And I just continue to worry about the increase of the people and being able to sustain the, you know, the cost structure.
I think the thing that was alarming to me, and, you know, I mentioned it during the school department presentation, is that the union is able to negotiate additional headcounts as part of their contractual negotiations. I mean, I find that very concerning that, you know, what kind of precedent might that be setting?
Yep.
Oh, I don't know.
Yep. Okay, we want to move to the articles.
Sure. Kevin, you want me to jump in and then you can correct me when I'm wrong?
Sure, you can jump in.
And did I have a sheet for that, Steve? I'm sorry.
I think if you went actually to the vote sheet, that would help you out the most on it.
Yep.
On the articles.
Mhm. All right.
Given that there's an entire worksheet for the articles, yes.
Correct, yeah.
How'd I do?
All right, that's
The other tab,
the other tab, yeah.
there you go.
There you go. Good. So we did capital outlay already. So debt service fund, which is the second one. This is the fund where we fund all of our bonds, including the Galvin Middle School, which is on a debt exclusion. Now, remember that $1 million comes straight off the top of our tax levy that is not appropriated at town meeting because we had a legislative act, God, years and years ago. So this is added to that amount. So our total bond payment, think of it as, 5.1 million. This is level funded basically from last year. The Galvin portion of this is 2,481,148, I believe, Kevin, and the rest is what, 2.652, I guess. That's level funded from last year.
Yes.
Okay.
I think if you make that bigger, there might be some explanations there. Article 4, which is one of my favorite articles. And it used to be an article where we actually did not state the amount. But the Department of Revenue has told us we need to do this differently. So this is what the Board of Light Commissioners have voted to pay the town of Wakefield the pilot program, payment in lieu of taxes. And for next fiscal year, it's $945,828. And that's from the MLD receipts.
Steve, on that one, I noticed from their memorandum that they're only increasing it, was 1.45% per year?
1.5% per year, yes.
1.5.
Yeah, so how did that end up so low?
I don't, that's a great question, Dan. That's what was presented to us.
So Dennis and I visited them a couple of meetings for about 4 or 5 years ago.
Yeah.
In the first 3 meetings, they told us, get out. We're just going to do it however we choose to do it. And then in the last couple of meetings, they said, well, we got this study, and they provided a study. And in the memo, he speaks to that a little bit, but ultimately, I don't know that we have no way to fight it, but we didn't fight it or don't fight it, I guess. And it is the payment in lieu of taxes, so.
Right.
If one way,
Go ahead, Doug. Yep.
yes,
I'm
the
looking to
only
try to
way
s-
we can fight it is we can, we could sell them.
Or at least threaten.
Yeah, I mean, that truly is probably something they should have on their radar, that we own them as a community and that they are probably now worth, probably $100 million or so to the town. So
Yeah.
whether they feel like they should pay a 1% dividend, I don't know. Feels like we'd get better in N-Star stock.
Yeah. I hear that. So that's where it came from. Their board, voted on it. Back then, it came up. And, he goes on to explain in the memo that their revenues went down, I think was the way it was described. Yet the board was, doing the right thing and still going to continue to increase it. So.
I will say we do work together with them on a lot of items that you
Yeah.
wouldn't necessarily with N-Star or Grid or anybody else. So.
Yep.
There is that part of it too.
Right. Trying to zoom out, I just can't see how to do that, sorry. Joe,
Yeah, I think for once I finally agree with Doug. I agree. I was reading the memo, 1.5% when I know my bills hasn't I wish mine only went up 1.5%. And they seem to be, I really would like to see their numbers, even though we don't get, something created by them rather than some audit that's done, because it just doesn't make sense. And I agree that the threatening with the sale is probably not a bad idea, because if we're increasing our budgets, 3-4%, and they're only doing a 1.5, that doesn't seem right to me.
Yep. Dennis?
I know when we sat down with them, and we've asked Victor before from Board of Assessors, who says he doesn't get into evaluating their equipment because that's State Department of Public Utilities sets their valuation. But where is our valuation for their moving equipment, all their trucks, their plant, all their property? He's got to have a value for the basic property for what it's worth. I'm not talking the power lines and the station down on Salem Street. I'm just talking their buildings and their moving fleet. To be able to assess them, it's got to be, in lieu of tax, it's got to be more than the $945,000. I think it's ridiculous, and I said it back then. I think we've got to get some more input, or either threaten to charge them to get an outside company to assess a valuation for the town, through Tommy Mullins Group, and let them determine it as an independent, not them coming up on their own. It's like the school department doing their own budget and saying, to hell with the town, this is what you got to pay. I don't think it's right. So I think we've got to find another way of coming up with not 1.5%. What is the value of their plant? And let's stop being good guys about giving them some of our Nahant Street pit for their storage if they're not even giving us consideration for anything else. I mean, for them saying that they're contributing to the tree, planting trees underneath their wires. I mean, they're the ones that are cutting them down because they're interfering with their structures. They're cutting down public shade trees without a hearing. So I think we could be mean on our end too. So I think we need an outside person and charge them to have it done. That's my opinion. Thank you.
Okay. Ed?
Ditto. Dennis took the words out of my mouth. I'm very interested in seeing the original study. I don't know how the hell they came up with even the base number. If I get it, I'd love to see a copy of that. I was going to
Yeah,
say,
I could probably find it
Yeah,
somewhere, Ed. And
let's say if the assessor had time, the assessor could weigh in but you probably need an outside firm, as Dennis said, to properly evaluate that. But yeah, it's like sticking their nose in our face here, so thank you.
Dan?
Yeah, so, I mean, just to pile on, I noticed in their memorandum that they use the kilowatt hours sold as some kind of indicator that the 1.5% is a good number. I would argue that it's a bogus number because the cost per kilowatt is a lot higher now than it was back in 2010. And so in dollars, I'm sure these have been increasing a lot. And what's also missing here is a history on the gas. I mean, there's pipes in the ground. The pipes are worth something. And I'm sure that all the gas value has increased substantially in terms of what they sold from 2010 to 2022. So their quote evidence, I think, is just plain bogus.
So Oh, Joe, go ahead.
Yeah, Mr. Chairman, I would suggest that we maybe create a subcommittee or to delve into this issue, because I think it's quite serious that they're saying it's 1.5%, and it just doesn't. As indicated, we should get some outside people to look at it. And I just make that suggestion, and I'd be glad to even make a motion to that effect.
Okay.
I'll second the motion.
So I was just going to ask the group then if, we created a small subcommittee, I guess, back then. We met with them, we talked with them. They came back with a 1.5. We had Peter come to our meeting. We could certainly, bring him to a future meeting. I only got the memo just not too long ago, although it was dated February. Maybe shame on me or whatever for not having it sooner and getting it out to you all, but I did just recently get it, I think. But we, I don't know if we agreed, we settled on the 1.5 for the 5 years back then. And then they obviously took it upon themselves to meet, discuss, and, agree to continue the 1.5, and he gave his logic in the memo. So I'm welcome to entertain, putting a subcommittee together to try to meet with these folks and bring back some findings. I know I have that report. That being said, the report's done by people that were prior in the industry as municipal gas and light people. Kind of a consulting group of themselves, if you would, was my takeaway from the report. It wasn't them physically, but it was friends, groups, and neighbors that were in the industry over the years, type of thing. So that's my recollection of it. And Dennis and I, again, we went to a few meetings. I have not been to a meeting with them in years, but anyway. So.
Yeah, Jim, I would just add, as of 12/30/2020, they publish their annual report every May, so it's coming out in a month or so.
Right.
They had about looks like it's about $26 million in retained earnings on their balance sheet. So, and they make a profit. It looks like net income is about $3.5 to $4 million a year. So.
Right, and they have a cap, right? DPU caps them, I'm gonna say 7.5 at 8. They can't make more than a number. I don't have the right number in my head, but they can't make more than.
But they've managed to retain. They've baked in this earnings over, the bunches of years. So now they're sitting on a,
Sure. Yep. And not that it's, good, goodwill is goodwill and things like that, but they certainly, I think we get some trucks occasionally from them. Steve, does the town get trucks like pickups or things like that you could use?
We often share trucks and equipment and, often.
Yeah, I was in the industry, not in the public, in the muni sector, more in the public sector. And, they do have fairly good looking new equipment for a reason, because they have to spend a certain amount of money. They have to spend a certain amount of money on gas mains. They're much more regulated the gas side than they are on the electric side, and et cetera. So
we also might want to wait on tapping into that money until a year or several years when we really are desperate for it, because you could probably get, if there's some sort of year where we have some big shortfall or some scary thing happening again, that might be the time that you could tap them for potentially a special dividend or something of that ilk.
Yeah, that's interesting. Yeah. Brian?
I'm curious how much of a shot across the bow it would be just to commission such a study to review their assets. Like, I have to guess that would not be received happily, that they would see it as an aggressive act on our part. And I'm curious if it's ever been done before, Steve.
The only time I remember the study being done was the one they presented a few years ago. 5 years
who-
ago, I guess.
Who were the authors of that report? Like, was it them
Uh,
themselves, or did they have some
They,
outside?
they
company?
had an outside team do it.
Yeah, it was a, within the municipal utility world, it was a consultant that's used by other municipalities.
Yeah, it's
And-
called
and it-
Energy New England.
Yeah, and it gave all sorts of metrics, across like locations and all the municipals. And, we were in the first quartile as in volume of money that we got relative to others against some metric or something to that effect. And I'm paraphrasing it, but we were to be grateful because we were there. Bill?
Yeah, so I think some of you know I spent 2 painful years on the board. But this is sort of a tricky one for me because I remember my first go on the finance committee, Evan, Pete Dion, and I can't remember who was with him at the head of the table. And I guess I'm going to ask Steve to back this up, and I'm certainly not defending them, but there is a lot of other goodwill they provide to the town that you can't quantify in dollars. And I don't think we should be short-sighted on that. The other thing is, as we sit here and discuss this and say we don't like what the number is, what would we want the number to be?
Right.
I mean, it almost seems like, and again, I'm not a fan, but seems just a little bit too easy to just sort of pile on and beat up on as I listen to this discussion. So,
As I did say, there is a lot, we share a lot of items together and we do a lot of things together. So yes, there is goodwill.
All right,
there's
so,
not-
Stefan, thank you, Bill.
yeah.
Hey there. No, that's a good point that Bill brought up. I just wanted to say that we're just looking at a number right here, but it would be great to see the logic that surrounds that number, and it would make it a lot clearer for the group.
Yep. So I'll start by finding the old study, and then maybe ask if we want to just hold a meeting to review the study amongst ourselves or try to kind of digest it and maybe figure out next steps. Going back and visiting them with a plan is certainly the right approach in my mind, whatever that plan might be. Dennis?
On this 945, if we just took that 945 and divided by a commercial tax rate, what would that give us for an asset rate? Just as
Yeah.
a rough number.
Steve or Kevin, do you know, what is it, the tax per dollar on the commercial? If you know.
Is commercial 24?
Is it 24? I thought it was 22.
Yeah, use 22. That's fine. What's that number?
43 million? That sounds like 40. Did I do that right, Kevin? 43 million?
Yeah, 43 million.
Yeah.
Yep.
I think this is a rough figure. That plant is worth more than 43 million.
Yeah, it is. So the thing with the utility, you got asset value, you got book value, the depreciation schedules, they get great accountants. I can just tell you again from some past history that they get great accountants that really, manipulate books. And the more you dig into the books, the more difficult it is to handle. And not that that's impossible, but I agree. It's a number. What's the total value of the assets? You asked Peter Dye on that, and he'll talk for an hour and not give you an answer. And I'm not trying to be wise about who he is, but it's just the nature of that. So.
I think, where do we sit for this year? Do we have to vote this amount of money, or can we just table this and nothing goes to town meeting until they?
No. We need to have this to balance out a town meeting. I think the key is going forward, frankly.
No, I tend to agree. Anybody else? All right, so the takeaway is I'm going to get you the previous report. I'll communicate via email and see if we want to, and post to hold a meeting to discuss that or what the next step might be for a group to again, identify when we go back, what we want to talk about. And Bill, good perspective. You were there for a few years, so appreciate that. So, okay. We're gonna move on. Okay.
Okay, town supplemental appropriation budget. We've done this the last few years, mainly because we know that there's going to be some areas, so it's not a surprise. So maybe we shouldn't use the reserve fund, and it makes the reserve fund a little bit easier to go through, I guess. So this year we're looking for $202,500 that would come from free cash. And two items really make this up. It's overrun in the legal account and a legal expert account, and that's really because of expert witnesses for the Walton School of $82,500. We did have a contract to claim and subcontract to claims on that one. And I think we got, Joe Bertrand may know better, but I think that the experts did a great job for us and the outcome was actually pretty good from our standpoint. And you may recall fire overtime was much higher going into this when you did review their budget earlier on. And we're looking for, that stabilized a little bit, and we're looking for 120,000 for fire department overtime. We may be back on, that doesn't mean we wouldn't come back for reserve fund for a little bit on either of those later on, but that's where we are today.
Great.
Okay, police and fire indemnification. Some of these you've already heard, as you know. So police and fire indemnification, and for, again, those that are newer on the committee, for injuries in the line of duty, those are not covered by health insurance, and they are not covered by workers. Well, they're not covered by workers' comp and health insurance. So we often have to put money into these accounts, and we put them into articles so we can use them over the, from year to year. This is a little bit of a higher amount than we've had. Normally it's, 20,000 or 30,000 or what have you. In this breakdown, 10,000 is for police and 120 is for fire, and that's for one firefighter. And it all ended up quite tragically at the end.
Okay.
Zoning, $50,000 for zoning recodification. We are establishing a zoning bylaw review committee for according to our charter, every year that ends in a 2 or a 7, we do need to relook at our bylaws. And one thing we did not look last time around was the zoning bylaws. So the zoning bylaws are very technical, and the devil's really in the details. And this is something we really need to have some expert assistance with. And it may be someone like Grabowski, who wrote the Bible of land use in Massachusetts. And I actually have a copy of that in my office. And actually Tom Mullen was on the other side of a case with him, interestingly enough. So we're looking for $50,000 for an expert to help out with that process as we recodify the zoning bylaws. And that will be tax levy.
Yep.
Jumping down, because you've already heard about the drainage and the quiet zone improvements and the Hart's water storage.
Excuse me, just, I did have a note I meant to ask when Joe was here. We had asked questions about the Hart Hill, the bond financial breakdown, and I meant to put those comments out earlier and I didn't get to it. So I was looking at some prior meeting notes, and we had questions, someone had questions, and speak up if you know you were asked the question and you got the answer you were looking for. But we were talking about the bond breakdown for the Hart Hill.
I'm looking to see if I have any, I don't remember.
Try to get revenue from Joe, and revenue from Joe was one question that I think Ed asked, and then bond financial breakdown of Hart Hill. It's not really related to the line item, but it was when Joe and I reviewed it, or it was reviewed.
The debt service was a $5 million, correct? On
I
that
think
one.
so. Yeah.
And what were the questions?
Well, one was about the breakdown of that bond, I think, and Ed, jump in if you.
Yeah, I was trying to get a sense of the estimates here in terms of
Okay.
interest rates and asset term.
So it's we had it over a 20-year term, even though I think this is 100 years old, this one. We had it estimated at 4% at the time, or Joe did. That's a little bit probably lower. I mean, might come in a little bit higher given today's rates.
When are
But
we
the
going
yield-
out for this?
Hmm?
When are we gonna get to market on this?
Well, assuming it gets approved at town meeting, I think we would be going out this summer.
Yeah, if you get it done before in June, before the rates go up again.
Yeah.
it's just-
Yeah,
I'm just
we
thinking
might
about-
hasten that because of that.
Yeah.
So the yearly payment on that was $367
Okay,
for 5 million, $331 for 4.5.
okay,
But some debt was falling off.
right.
So the new debt for the worst case scenario, 5 million, would be $70,000 roughly.
Okay. Yeah, those are my questions. Thank
Yep,
Glad I-
good. Thank you. What else on this list, Stephen?
I'll keep going, then we can jump to probably the most exciting one I have is the TIF agreement on 7 Audubon Road, and that's just looking for favorable action. So we have a company that is called Nanoramic Labs that is moving to a location on 7 Audubon Road. And if you are going up towards the back road to Market Street and you take the right with the Sheridan on your right, there's a white building on your left, and that's 7 Audubon Road. So Nanoramic is a company that is in the Seaport District right now, and they make electrodes and separators for electric batteries. And that's about all I know about them, technically. So they were looking around to go either to get out of the Seaport because they found it very expensive. We're looking to build a new laboratory and processing area. So they settled on, it was between us and Marlboro, and they settled on 7 Audubon Road. And working with the Mass Business Development and Erin Kokinda, Economic Development Director, and Victor Santinello, our assessor, we talked about what's called tax increment financing, which means that the improvements that you do bring to the building, provided that they are linked to increasing employees, and they're thinking of increasing, I think, by 50, 60 employees, you give them a break on their real estate taxes during the early periods. So we came up that we would give them a break of about $7,700 a year for 5 years, which is $38,000. The assessed value would increase by around $325,000 on that building for improvements they're making, provided that they stayed here, that they hired the people that they said they were going to hire because it's good for the economy. And we get a nice business and increase our commercial tax base because they're still going to pay taxes on, of course, what's there in the interim. So the other item is that they are able to, they got approved by the state for this and got on top of that $106,000 in state tax credits. I look at this as a kind of a marketing opportunity to bring in businesses to Wakefield. Boston Business Journal already wrote an article on this, which I was kind of, a little premature where town meeting hasn't approved it, although the town council has. And I've already got a call from another company up there and more people coming in, putting us on the map. So if we're, serious about increasing our commercial tax base, which we all would agree is less services on our police, fire, and schools particularly, this is a great way of starting out, and it's cheap money to get in a nice new green company that hopefully will bring in more to the area. So it's a favorable action. We're not spending anything. We're just not collecting $7,000 worth of taxes for a 5-year period.
Okay.
Great.
Stefan,
Last one I have. Oh, did someone have a question?
Stefan, go ahead.
Yep, just a quick question. The length of the lease for this company?
The length of the lease.
Yeah, I just assumed that it's greater than the number of years the TIF is in place for.
Yeah, it is. Let me pull it up. I was amazed at how much they're paying. Actually.
I think it's usually like 10 years.
Yeah, it's
or
10
5
year
to
lease.
10 years.
10 year, yeah. And the TIF is for 5.
Thank you.
Great.
So, Jim, I'll cover the 2 retirement board articles?
I think Steve had one more. Yep.
Just have one more, Dan.
Oh, okay.
This one we actually talked about a few years ago, and this is a Mass General Laws, Chapter 59, Section 5C56, which basically allows National Guard troops who are activated being allowed a abatement for the real estate taxes at the discretion of the Board of Assessors. We were asked by the Veteran Service Agent, or the Board of Assessors were asked by the Veteran Service Agent to submit this article. We had this before, but it had a sunset clause of 3 years, and last year we missed it, so we should have re-upped it then. But when we did have it before, just so you know, there were 3 actual Guards members that took advantage of it, able to assist them in keeping their homes for their families, and any money of that comes out of the overlay account. So it's certainly not a, it doesn't break the bank.
Yep. Okay, I know Dan has some things to cover. Just on the mechanics, Steve, if we chose, would we vote articles tonight, or just maybe defer and vote everything at a future meeting?
If, I don't know, I think you could you squeeze them all in, Mr. Sullivan, Mr. Chairman? I think you could.
Well, we'll see about that. Dan, go ahead. Do you want me to stop sharing?
Yeah, I'm gonna share a screen. Let's see. And this one.
Does he need permit? Yep, he's got permission. Good.
Yeah, Steve gave me permission. Can everybody see that?
Yep.
Great. And also these documents are in that link that Jim provided in case you you grabbed it early, might have got in late. So the COLA base. A few years ago, we increased the COLA base from $12,000 to $14,000. And what this means is that for retiree, if their pension, let's say, is $10,000 and the retirement board votes a 3% COLA, they get a $300 increase in their pension. However, if their pension is like, say, $50,000, they don't get a $1,500 increase. It's limited to 3% of $1,400 or $420. And it's a piece of legislation that years and years ago was much, much lower, but it got increased, I want to say about 20 years ago by the state. And the state also said, by the way, cities and towns, you have to pay for it. We're not going to pay for it anymore. And therefore, if you want to increase that COLA base, you can do it in increments of $1,000 to any amount you want. I mean, we could put a COLA base at $1 million. Wouldn't matter because nobody gets a $1 million pension, but there's no upper limit. It just has to be done in increments of 1,000. So there's a lot of systems that have increased the COLA base to 14,000 and higher. There are some 16s or some 18s out there. There's a number of increases. The state right now and the teachers are at $13,000. And all of our teachers of Wakefield that are retired teachers have a limit of 13. The retirement board has voted to increase it to 16,000. We have 341 retirees and beneficiaries with an average benefit of $33,000. So At $420, they're really getting about a 1.3% COLA, which of course, until very recently, that was matching the rate of inflation for the last 8 or 10 years. But as we all know, in the last few months, that has ballooned to a much, much greater amount. We have 41 disabled. They were averaging increase now is about 1.4%. If the town approves the motion that we're going to put forward for the retirement board is going to be for $16,000, and that would increase the COLA limit to $480 or 1.45% for everybody. Just a reminder that we don't have Social Security, so when Social Security goes up, 3% or 4 or maybe 6%, next year or more, the Social Security recipients are going to get a much bigger COLA increase than our retirees. So one of the things I did was, of course, had to figure out what this is going to cost, as everything has a price, and this is no different. So we're paying about $12,500,000 per year to our beneficiaries, and so increase in that COLA is going to have an impact on the $12,500,000. So at the bottom of that chart, you'll see the $14,000 COLA base. We now have approximately a $210 million liability. Our assets have increased substantially. We had a very good couple of years, so it's up to $157 million. In our unfunded liabilities, I'm estimating about $53 million with a 75% funded ratio. And our fiscal appropriation for 24 right now is at $7 million. So if the town approves the COLA increase, our accrued liability go up to $211.8 million, roughly a $1.6 million increase in our unfunded liability, and our funded ratio drops. So we're really talking about a $1.6 million add-on to our liability. That's the underlying cost of going from 14,000 to 16,000. We have an appropriation that's based on an amortization schedule, and that amortization schedule right now is running out to 2036. So think of it as being like a bond. And what we'd be doing is increasing our payments for fiscal 24 by $197,000 had this have been approved a couple of years ago. Everything's got a delay, and you'll see at the note that if this is approved, the impact on our budget and the retirement budget in particular would not really show up in fiscal year 26. That's why you see on the vote sheet a 0 for this particular article, because everything's delayed until a future year. So for from 2026 to 2036, we'd be spending about $200,000 per year more than we otherwise would spend by granting this increase in COLA base from 14 to 16,000. So happy to take any questions on the impact of that article. Okay.
All right. No questions.
No
I
questions.
I have no questions, but I'm appreciative of what you do in this, Dan, year over year.
Thank you. So the next article, hopefully I can click it, and yeah, it worked, I think. So this is a death benefit minimum increase that we're looking at. And basically, many, many years ago, it was established that if somebody died while in active service to the town, their surviving spouse would receive a benefit based on years of service and salary and all the other factors that go into retirement. But a minimum was set of $250 per month. And we hadn't changed it. Lots of other communities increased it, and you can increase it up to $500 per month or $6,000 per year. We have very few people that have ever been that low and have died in terms of, as an active employee. We had one this year, And the retirement board staff brought it to the board's attention that it said, hey, we had this person passed away, unfortunately, and their pension for the surviving spouse was less than $500 per month. I don't remember the exact figure. And so they brought it to our attention and said, maybe we ought to increase it to the, from 250 to 500. So I pulled up the data, and we have 4 beneficiaries right now who would receive some kind of an increase, some as little as a couple $100 and a couple of $1,000 or more. So the total payments for these people would increase only $4,700 a year. So we're really talking very, very small change, very small impact. And you'll see that I did the same thing as a previous page regarding the impact on the liability, and it's only $60,000 because it's not only the 4 people who currently would receive a bump, but it's also any future bumps down the road, future retirees, or I should say active employees who died with a spouse. So the impact is just $18,000 per year over the next 11 years from fiscal year 26 to fiscal year 36, and then it'd be a small increase after that in terms of normal cost. So this is really a small item. Retirement board voted unanimously to approve the increase from 250 to 500. Again, I think the $250 is probably a number that's been around for at least 50 years or since the beginning of Chapter 32 in 1947, without any modifications on our part. So again, very small change and something that the retirement board thought made sense for the 4 people that would be eligible for some kind of a bump. I don't know if Kevin wants to comment on either one of those because he's the chairman of the retirement board, but those are the 2 articles from the retirement board.
No, that was a good job, Dan.
Okay. Any other comments? I don't see any hands, but great, Dan. Thank you. Appreciate the work.
Yep, thank you.
Okay. So on the agenda, the last item is to vote on everything. I am willing to do that as long as the rest of the board is willing to do that. Okay. I see shaking heads.
Yeah, nobody's asleep, right?
Nobody's asleep, and I'm assuming if you needed a biology break, you made arrangements. So, Bill, Joe, do you have a sheet in front of you you could work off of?
I have a sheet for the budgets, and you're gonna have to put up a sheet for the articles because I misplaced it somewhere in my office. So I'll
no problem.
print the budget right now.
Steve, you want to go through the budgets first then?
Yes.
And we will, would we entertain the budgets by the groupings for which they are bolded?
Exactly.
Right. Okay, you want me to go?
You got it.
I move for general government the sum of $2,680,888 with $2,676,388 in tax levy and $4,500 from available funds.
Second, any discussion? All those in favor for the total general government budget of 2,680,888 with 4,500 coming from available funds and tax levy 2,676,388. Anyone
Aye.
opposed?
Aye.
All in favor? I don't see anybody unopposed. Stefan, you have a question? Sorry.
Oh, sorry. I didn't have a question. I was just voting.
Got it. Yep.
Yes.
That makes sense now. Thank you. Joseph.
Protection of persons and property. I move the sum of $13,698,536 from tax levy.
Second.
Any discussion on total protection of persons and property? Motion before you then is total protection personal property, $13,698,536. All those in favor?
I,
Anyone opposed? Thank you.
For human services, I move the sum of $1,003,195 from tax levy.
Second.
Discussion.
yeah, the veterans. So I'm gonna share my screen again. I hope you can take that away from me. Well, thank you, Ed, for the first this first piece. And I think both of these are that I'm gonna show are available on Jim's link. So on the veteran services, we talked at length about when they presented the budget, and it's $170,000 for the veterans receipt. And if you recall from that meeting, we asked the town council to reduce it to something that made more sense. And they refused, and I can understand why. They didn't want to be perceived. I mean, the optics of perception that they're cutting veterans benefits, even through December 31st, we'd only spent $45,000 out of a $170,000 budget. It didn't make much sense. So Ed said, hey, I can get some cherry sheet information on veterans benefits across other municipalities. And you can see the trend going from, maybe I should blow it up a bit if you're difficulty seeing it. So the trend is clear that the amount of benefits being paid out to veterans has been on decline. And for certain communities, it's been huge. I look at Malden, 47% decline. Wakefield had a big decline, 17% per year going down. And then the fiscal 2022 is an expectation. The actual amount for 2022 is going to be close to 70,000, and I'll show that here in a second. But the decline has been substantial across all communities. And for us to stay at $170,000 really doesn't make much sense. So I asked Kevin for our most recent numbers, and hopefully this works. Let me blow it up a little bit. So for fiscal year 21, we spent $80,000. And for fiscal year 22, as of April 12th, just a few days ago, we've spent $48,000. And if I annualize that and round up, I get 2022 number of $70,000. So to me, to have a budget line item of $170,000 for 23 just does not make any sense. I understand where the town council is coming from, but no veteran is going to lose money. Even if we cut this to say $100,000 and the veterans come through and say we need 105, they're going to get it one way or the other. They're going to get it either a reserve fund transfer or the fall town meeting or whatever. So no veteran is going to lose any money. But in terms of our role as a finance committee and looking at budgets and saying, does this budget make sense? We look at to make sure that we're spending the money or budgeting properly. To have $170,000 for veteran recipients, to me, makes absolutely no sense. So I think, and I don't recall what I offered up at when this first came up. I think I said 130,000 or something like that. But I would like to reduce the $170,000 to something that makes more sense, probably in the neighborhood of, maybe 120,000, cut 50 and leave some room in case, there's a spike, an unforeseen spike, a bunch of veterans come out of the woodwork. But I would like to reduce it at least $50,000, and I'd love to hear what other people are thinking in terms of reducing that line item in the veterans budget.
I'll second
I
the
would
motion.
say, just looking at notes, we had talked about, it was about 70,000 over, when we talked about it in January. Dennis had recommended 130, and that number seemed to get banted back and forth, and that's what we brought back to town council was 130.
130,
So,
yeah.
Just looking at notes. Doug?
Yeah, mute.
Yeah, I agree with Dan. I think we can take this budget down. I think our job here is to make budgets as clean and as appropriate as possible. I mean, I think what, like, you know, the other information we had, like, this is a startling number, and probably like a scary impact of COVID is that steep decline in the last 2 years. That's probably very telling. And so I don't think that it's likely to bounce back, because I would wager probably a lot of our veterans spend was on, you know, Korea, Vietnam, and maybe even some World War II vets.
Okay, Ed?
Yeah, the decline was also pre-COVID. I think this is a demographic shift going on here, in terms of some of the older veterans passing away. I don't think the younger veterans reach out on these type of things. This is the type of program that would require significant outreach to get those numbers back there. And I know I'm, you know, mine in Somerville is a 67% reduction in the last 6 years, and a 50% reduction over last year's reimbursement. So it's very, very dramatic. And we're seeing this trend all across the board here. And as Dan said, is if we're wrong, if the numbers creep up during the course of the fiscal year, we can always go back for a reserve transfer or what we need to do to replenish the account and bring it up. But I think this is a very reasonable motion. And I understand the reluctance of some of our elected officials to be, you know, they don't want to be perceived as anti-veteran, but this is the prudent, responsible action to take, I think.
Yeah, I think, you know, I was at the town council meeting when it was discussed, and they, I guess, agreed in principle, but deferred a year is what some of my takeaway was from Jonathan Chines, for example, and somebody else I figured who spoke up about it. They felt it could be COVID related or this related, that related, without necessarily having data in front of them, of course, and appreciated the prudent look at it from the finance committee, but they felt waiting one more year was not going to be of significant harm. I completely understand the data, and my only point would be whether for the dollar amount in this particular budget, whether that is something worth debating at town meeting, you know, or kicking it down the road. I'm a little torn, and we'll see what happens if somebody makes a motion to change or not change. But any other discussion?
I'll make the motion that we reduce it to that line item to $120,000. And I do recognize the risk that the $50,000 could turn into the same thing we had about 10 years ago on the Goose article, where $25,000 was argued at for about an hour at town meeting. And Jim, I hear you, and I agree with you. It could go on for a long time, over 50 grand, but that's my motion anyway.
I'll second the motion.
Who seconded it?
Ed did.
Ed did, okay.
So the motion before us then is, I don't have the budget in front of me, but you made a motion to lower the line item by $50,000, Dan?
Right, from 170,000 to 120,000, the veterans recipients line item.
Thank you.
Jim, the total for human services would be $953,195 if you deduct the 50,000.
Okay, so the motion's been made, it's been seconded. Discussion on the motion to reduce the line item from 170 to 120, $250,000, which would in turn reduce the total of the human services. Discussion. Can somebody stop sharing? So I
Oh,
can see.
sorry.
Yep, that's fine. So I can see everybody. So, thank you. All right, seeing no discussion is up. Yep, thank you. Bill?
Just a quick question. You know, it seems like we're always behind on this stuff, right? You know, things flow downstream to us and town councils voted on it, and it's, you know, oftentimes I think it's awkward for us, you know, if we believe that the town council will really look at this next year and believe the data and make some adjustment. I guess I side with Jim and saying, do we really want to bring this to town meeting to talk about $50,000? I'm struggling. I don't disagree with it overall, but I think it ought to, the work should be, you know, ideally done in advance of it getting to the point that, you know, we're coming against it, I guess. So that's my struggle.
Yep, thank you. Doug, Dennis, sorry.
My struggle's the same way. I have a problem with all this money being turned over in all budgets at the end of the year, when we see historically that a lot of these are not being spent, and we just say, well, let's trust the group, they're not overspending. I'd rather have them have the liquidity, and we don't have to come for a reserve fund transfer. This is the same thing, and it's for short money. I would rather see all town budgets be reviewed a little closer next year and start closing the loopholes on some items that historically are not even coming close. And if I can get that guarantee, then let this 50,000 ride for a year. We get more to gain on getting all these other budgets to get some of this fluff out of them. So that's my opinion. Thanks.
Got any other member have any discussion?
Doug has his hand up.
Sorry, Doug.
Yeah, I mean, I think I hear you, Dennis, and I hear you, Bill. I think one of the things is what is our role other than to like make sure that we have some accountability in terms of, frankly, in terms of from the town council. The alternative here is, to be fair, like, let's not kid ourselves that the town council is actually really doing this budget. Steve, like, you know, you could sort of commit to us that you're going to make it 130 next year if it comes in at short money, or
less.
I wish I had done that this year. It was my mistake this year not bringing it down. I should have done it this year.
Right. So that's the other thing is, like, you know, I mean, I also, like, you know, I'm the master of having fights that I can't win. But but is it worth it to us as a board? Like, you know, again, what we don't want to do is we don't want to get the cantankerous. I'm torn because I'm with Dan. I want to actually have sometimes when we say like, oh, this budget's just wrong, and like, you guys really should fix this, and frankly, that's our job. And then the question is like, you know, if we fight them on 50 grand here versus, you know, when we need to fight them for, you know, $400,000 or $500,000 in a subsequent year.
Or the schools for $1 million.
There you go.
Yeah. Yeah, no, exactly. You know, in some time, well, anyway, go ahead, Joe.
Yeah, I'm leaning, I'm initially in favor of it, but now more and more I think about it, I don't think it's worth the fight. I think our fights could be in more important issues than this.
Okay. Bill?
So if Mr. Mayor will promise us next year, you know, that this will be adjusted, so to speak, you know, it just obviously gives me a lot more confidence on how I feel about it.
Unless there's a change in the metrics, that's certainly my intention. Wish I had done it this year.
Great.
That's good enough for me.
Yeah, again, my only opinion is in my old utility world, rule number 1 was don't make the front page of the Globe or the Herald, you know, so in my little world now, in this subcommittee, I don't want to make the front page of the item either, I guess, but we'll do what the board decides to do. So, All right, so the motion before you is to reduce the budget for the line item that I didn't write down from 170 to 120 in the Veteran Services budget. So all those in favor of the $50,000 reduction.
I'm still in favor.
All right, so I'm showing Dan Sherman, Doug Butler, Brian Cusack, and Ed Bean. Is that correct?
That's correct.
Okay.
All those against? Stefan, yep, Stefan, your hand is up. Thank you.
So that's all the rest, right? No one abstained?
No one abstained that I could correct. No one abstained.
Okay.
All right, so the motion does not carry, Steve. Is that correct?
The motion does not carry.
Okay.
Now do we revert to the original
Can we
motion?
re-vote on it, the first?
Yeah,
one?
so, yeah, would you repeat the originals, Joe, please?
Yeah, absolutely. For human services, I move the sum of $1,003,195 from tax levy.
Second.
Any discussion? Motion before you is about for human services total for $1,003,191 from tax levy. All those in favor?
195.
Sorry, 95.
We
All
get
those in
$4
favor.
from you, Jim.
Anyone opposed? Motion carried unanimously. Thank you. Good dialogue. Next.
From Public Works, I move the sum of $7,584,130 with $7,492,408 from tax levy and $91,722 from available funds.
Second.
Very good. And this is the correct number, updated number, Steve, right?
I was just checking that. Yes, Kevin?
Yes.
Yes.
Okay. Discussion. Motion before you then for total public works is $7,584,130 with $91,722 from available funds and $7,492,408 from tax levy. All those in favor?
Aye.
Anyone opposed? Stefan, you were in favor, I assume.
Yes, that's correct.
Thank you. All right, Joe?
Water Enterprise, I move the sum of $6,204,494 from available funds.
Second.
Any discussion? No discussion. So Water Department for $6,204,494 from available funds. Thank you.
Sewer Enterprise, I move the sum of $9,148,699 from available funds.
Second.
Dialogue. Motion before you for the sewer enterprise is $9,148,699 from available funds. All those in favor? Anyone opposed? Okay.
Total for Wakefield Public Schools, I move the sum of $47,722,077 with $47,607,077 from tax levy and $115,000 from available funds.
Second.
Discussion. Very good. For Wakefield Public Schools, $47,722,077 with $115,000 from available funds and $47,607 and $77 from tax levy. All those in favor?
Aye.
Anyone opposed? Very good.
The library, I move the sum of $1,877,097 with $1,815,376 from tax levy and $61,721 from available funds.
Second.
Any discussion on the library? Motion before you for $1,877,097 from the library with $61,721 coming out of available funds, leaving $1,815,376 from tax levy. All those in favor?
Aye.
Anyone opposed? Thank you.
Vocational school, I move the sum of $2,163,315 from tax levy.
Second.
Any discussion? All right, for the total vocational schools, $2,163,315, all coming from tax levy. All those in favor?
Aye.
Anyone opposed?
Unclassified, I move the sum of $2,605,082 with $1,998,577 from tax levy and $606,505 from available funds.
second,
Any discussion? Unclassified, total of $2,605,082 with $606,505 coming from available funds and $1,998,577 from tax levy. All those in favor? Anyone opposed?
Benefits and administration, I move the sum of $19,483,514 from tax levy.
second,
Discussion. All right, total benefits and admin for $19,483,514, all from tax levy. All those in favor?
Aye.
Anyone opposed? Okay,
MLD benefits, I move the sum of $2,470,373 from available funds.
wish I could say no, but second,
discussion. For MLD benefits, total amount, $2,470,373, all from available funds. All those in favor?
Aye.
Anyone opposed? Anyone opposed? No. Okay,
Do you need a total, Steve, or not?
No, I think we're good.
Oh, all right.
You're good, Kevin?
I'm good.
Okay.
so we need articles.
Article.
Sorry about that.
That's fine. Can you see it? No, I gotta share it, dummy.
Yeah, but that's gonna be hard to vote, though.
Pardon me?
You say if you share it, you won't be able to see who's voting.
Oh, yeah, you're right.
Mhm.
I've got it up if you want me to.
Go ahead, Dan.
Okay, so capital outlay, the motion is 2.1 million from tax levy with also with, should water and sewer be separate, Kevin, or all one motion?
You can do it separately.
Okay, 2.1 million from tax levy.
second,
Discussion? See no discussion. The motion before you is for capital outlay, a total of 2.1 million from tax levy. All those in favor?
aye,
All right,
Anyone opposed?
capital outlay for water. The motion is $875,000 for the water enterprise account capital.
second,
Dan, can you say from retained earnings on that also?
Right.
Okay, from retained earnings, very good.
Is there a second?
second,
Any discussion? All right, the motion before you, capital outlay for the water department, $875,000 coming from retained earnings. All those in favor?
Aye.
Anyone opposed? Okay,
Capital outlay for sewer, $862,000 from retained earnings.
second,
discussion. Motion for you for capital outlay for the sewer is $862,000, all coming from reserve funds.
Retained earnings.
Retained earnings, sorry, retained earnings. All those in favor? Anyone opposed? Okay,
Debt service fund, I move $4,133,698 from tax levy.
second,
any discussion? Motion before you then for debt service funding is $4,133,698, all from tax levy. All those in favor?
Here's what I found.
Uh-oh,
Uh-oh.
anyone opposed?
Siri.
Yeah,
should we do?
tomorrow I'm gonna get all sorts of stuff in Google about tax levy and available funds.
Which one more day to do your taxes?
Yeah. For Light Department, payment in lieu of taxes, I move $945,828 from available funds receipts.
Second indirect.
Discussion. Okay, the motion before you then for the light department is $945,828 coming from the municipal light department receipts. All those in favor? Anyone opposed? No one opposed.
Town supplemental appropriations, I move $202,500 from free cash.
Second.
Any discussion? So, okay, the motion before you for town supplemental appropriations, $202,500 to be taken out of free cash. All those in favor?
Aye.
Anyone opposed? Thank you.
For police and fire indemnification, I move $130,000 from free cash.
Second.
Any discussion? Motion before you, police fire indemnification for $130,000 from free cash. All those in favor? Anyone opposed?
For eminent domain, I move the whopping sum of $1 from tax levy.
Second.
Discussion. Motion before you, eminent domain for $1 be taken from tax levy. All those in favor? Anyone opposed?
For trash collection, I move $2,292,046 from tax levy.
Second.
Any discussion? Motion before you for trash collection, $2,292,046, all from tax levy. All those in favor?
Aye.
Anyone opposed?
For zoning recodification, I move $50,000 from tax levy.
Second.
Any discussion? Motion before you is for the zoning recodification, the amount of $50,000 in tax from tax levy. All those in favor?
Aye.
Anyone opposed? Thank you.
For townwide drainage improvement, I move $900,000 to be borrowed from, I guess, from a borrowing. Is that the term you want, Kevin?
Yes,
Okay,
authorization to borrow.
authorization to borrow. Very good.
Second.
Any discussion? Motion before you then is for townwide drainage improvements to sum of $900,000 to be authorized to borrow. All those in favor? Anyone opposed? You.
For quiet zone improvements, I move $2 million for authorization to borrow.
Second.
Any
Steve?
discussion?
I'm sorry, Jim.
Yep.
Just a question for Steve. Steve, did we want to put 2 million or not
Up
to
to.
exceed up to?
Up to, I think it would say no, up to 2 million.
Up to
Because-
2 million?
Because
Okay.
hopefully, I mean, I think it's incumbent in that anyway, but we have the $1.2 million grant from the federal government. So this is to supplement it, but I don't trust, until I have it, I don't trust it.
Got it. Okay, up to $2 million for borrowings.
Second.
Which is how I had the town council voted.
Motion before you then is for up to, for the quiet zone improvements, a borrowing authorization to borrow up to $2 million.
Yep.
All those in favor?
Aye.
Anybody opposed? Okay,
For the Harts Hill water storage tank, I move the sum of $5 million for authorization to borrow.
Second.
any discussion on the Hart Hills borrowing? Motion before you then is for the Hart Hills water tank, the authorization to borrow $5 million. All those in favor?
Aye.
Opposed? None. Thank you.
For the retirement increase the COLA base, I move favorable action on the article.
second,
Discussion on the COLA increase. Motion before you then is retirement COLA increase, recommending favorable action. All those in favor?
right,
Dan, do you have to put the dollar amount in on that?
Oh, yeah, I should say $16,000 as part of the motion. Thank you, Kevin.
So the motion before you then is for the retirement COLA amount to be $16,000, recommending favorable action.
Correct.
All those in favor? Anyone opposed? Dan?
On retirement, increase the survivor allowance to $500 per month. I recommend, or if my motion is favorable action.
second,
Any discussion? The motion before you was a retirement to increase the survivor allowance to $500,000, recommending favorable action.
How about $500 a month?
What did I say, 500,000?
Yeah.
That's it, it's
All right, I'm
10:30.
gone- I'm gone tomorrow.
You just broke the bank.
$500 a month, favorable action. All those in favor? Thank you.
For TIF agreement, 7 Audubon Road, I move favorable action.
Do we need the dollar amount on that or not, Steve, right?
No, no dollar amount.
Is there a second?
second,
Any discussion? All right, the TIF agreement for 7 Audubon Road, recommend favorable action. Motion before you. All those in favor?
Aye.
Thank you.
Did everybody vote on that one?
Was there anybody
Hey.
opposed? I'm sorry.
No, I didn't see. Okay, I got everybody. Thank you.
And last but certainly not least, National Guard abatements, I'll move favorable action.
second,
All right, National Guard agreements, motion before you is for favorable action. All those in favor? Anyone opposed? Okay. I think that completes the cycle. Any committee member comments?
Jim, do you want me to go through the latest version of the forecast so people can see what kind of shape we're in?
I was just curious on the deficit for this fiscal year, or the, what free cash was going to be used, if any.
Let me share the screen.
Yep. And Steve, the SPED funding, we didn't need to do anything to refund the SPED account, correct?
No, no, not at this time, and nor do I hope we have to this year at all.
Right.
Great. So the bottom line for me, my estimate, is our deficit spending for this year is only $223,000. And you'll notice that going forward, we get positive from this point forward. And again, just a reminder, the people that I'm using a different local receipt number, 8.4 million to Kevin. Kevin's using 7 million even, I think, or Steve. And I'm not sure where Steve lands on this. He's sort of.
I'm going with Kevin because he cried.
Yeah, and I wanted to have you go over this, Dan, before we voted. It just makes sense intuitively to me. Try to remember to do that before we start voting, so people have a sense of that number. So appreciate it. Yep.
Yeah. So basically, yeah, it's not bad. I mean, everything's much better than it was a year ago, and that's been a consistent message. And you asked about free cash. So we're down to about 4.8 million at the beginning of the year, and then 4.6, but then it starts going up after that. Our debt service goes up, our stabilization goes up, and our reserves, this is the other one I look at, is right now at 7.1% of total budget. We have a policy of 10, but I suspect that when 22 is all done, 7.8 is going to go up because receipts, local receipts, I bet are running higher than we're estimating. So Kevin, I'm going to put you on a spot. How are our local receipts running at this point for fiscal year 22?
Right now, we are at approximately $6 million. And, you know, it's hard to say with regards to building receipts, if any of the big projects, if they're going to be pulling permits this spring or before the end of June. The only other big influx of money that would be coming in would possibly be on motor vehicle excise. That right now we're about 800,000 less than last year, but I know we just did a commitment of about $500,000. So we should be in decent shape there. So we should hit our number that we should be around 7 million or just above that, maybe 7.2, 7.3.
Yeah, I was gonna say, if we're 3 quarters for the year and you got 6 million, that annualizes to 8, which is where I'm predicting 22 to land. So dinner's on the line here between 7.2 and 8. We'll see who's closer.
Ed, comment?
Just wondering, I know the House Ways and Means came out with the new cherry sheet. How did we do?
It wasn't a big change for us, a little change on charter school reimbursement. We had already gotten the big bump in Chapter 70. So not a big change for us. The unrestricted local aid, I hear the Senate is going to kick that up a little bit. So we could see a couple 100,000, you know, in that on the cherry sheet before the end of the year.
Right.
Yeah. So if we have a deficit of 223,000 and we get a couple 100,000, we could end up with a net zero this year for 23.
Well, the other factor is you don't know what your new growth is. In all likelihood, the assessor's been conservative in projecting that. So come the fall, that's probably going to go, you know, the new growth will be higher.
Yeah, I mean, we've got Steve and I agree with a $3 million estimate right now, but that could go higher.
Yeah. Or lower, we don't know. Depends on the power line and whether that comes online.
Yeah.
All right. Dan, thank you. Very good. My only last comment. So town meeting is when? Last 2 comments. Town meeting is
May 16th. It is Monday at 7 p.m. We're back to the Monday schedule. I'd love to think we could do this in one night at town meeting, but
dreamer.
It may go to 2. I will be in touch with the chairman about doing a we usually do a pre-town meeting primer on what's going on, where the budget is at WCAT. So we'll have that coming, and then we'll also have somewhere between the end of June a reserve fund meeting. So any subcommittee minutes, that's a great time to get them in. I know that you know, there may be a couple of subcommittee meetings we're still looking for. We can get them in and make sure we have.
Brian, I did get yours, and I think that'll be adequate. So for me, we'll probably have one more meeting after town meeting. At this point, I thank you all from the committee for the attendance. We had a really good showing this cycle and a lot of engagement by a number of people. You know, usually Doug Butler engages and a lot of other people engaged as well this year. So that's all good stuff. So I appreciate that. To Steve and Kevin, thank you. And Dan and the forecasting committee, the numbers, you know, really look good and something, you know, we should all be thankful for and relatively proud of the effort. So thank you all for that. And I think at this point, I would entertain a motion.
I just want to say, Jim, thank you. Jim, thank you for guiding us through this journey. Did a great job. And I'll make a motion.
Yeah, here.
Thank
I'll
you.
make a motion to adjourn.
Second.
Very good. And motion to adjourn. Thank you all. And we'll see each other around town, and maybe we can have a post meeting, just not at 10:30 at night somewhere other than on Zoom.